So that explains the mask. And so most of the time, I'm going to try not to have. I would like to take it off and maybe point the camera a little bit higher. But anyway, that's the mask thing. I don't want you to think it's too weird or anything. And also, I appreciate you letting me participate via Zoom because of my current situation. However, it's not long term. But my current situation has afforded me, in which I've tried to relay in my communications, my considerable time I've spent in hospitals and skilled nursing facilities, and the learnings of the Affordable Care Act, the Patient Bill of Rights, both federal and California. And that's when I started to become a real advocate of patient rights. And that's one of the things I'm hoping to bring to the table. The other thing I want to mention is not everything was posted on the agenda. My entire resume is on LinkedIn, and I would like to invite everybody listening in the room or on Zoom. You can just Google LinkedIn/Anna Stockel, ANNASTOCKEL, and that's my entire resume. It's long, so I just try to, like, my resume that you guys have is more of a, it's long, but that's the short story. That's the short form, if you will. And I also wanted to say, one of the things I've read everything I can get almost everything I get my hands on. And I really appreciate the policy regarding the conduct of board members. So one thing I did want to say, if it doesn't have to be right this second, but before the meeting concludes, I do have some references that I would like to relay to both the board and the people in the room. And I think that's especially important because I've read the surveys from the public regarding the board, and I can see they want to put trust in the board, and I want to make sure that I highlight that is something that I can also bring to the table, is trust of me. So I gave you the one for the I worked with Johnson & Johnson on a medical device, but things I just would like to highlight, and everybody will see it on LinkedIn. But Charles Lindquist, a passion for excellence and a compassionate side, always best quality, always willing to learn. Clear objective from John Randall, who worked for me, clear objectives and tools that gave us the autonomy and backing to successfully complete projects, providing focus, providing good principles, empowering manager, and nurturing unique strengths of each individual and giving authority. Motivation, Dan Grace, motivation, focus, drive, attention to detail, fantastic problem solver. Another customer. Some of these are customers and some of these are workers. Truly a problem solver and go-getter. Saima, I loved her. She was a firmware engineering of mine. Skills of leadership, excellent motivator, get the best out of the team, no matter how demanding. I'm not reading everyone out loud in the interest of time. Easy to communicate. Kevin Just, a customer, when I had an IT company, they made a mistake, and he talked about how I helped them determine the extent of the problem and helped them fight for their rights. And I like that he wrote, "You can trust my work." Bob Gropo, one of the smartest people I've ever worked with whom I've ever worked. Business acumen, customer interface skills, technical background, managing complex projects. So I'm summarizing now, but I really encourage everybody to look through these, everything that they wrote. Donna Fedor, inquisitive, never stops learning better ways to do things. If she has a job to do, she'll get it done. And I already quoted, and you have it, Paul Hader, my customer at Johnson & Johnson for the medical device. So thank you for the opportunity to read those. I also want to mention, I'm a big fan of SpaceX and Elon Musk, and I know that could be controversial, but what I like is a company like SpaceX, people have to be comfortable with raising problems, including and especially if they are their own. If a company published people for bringing problems to light, rockets will blow up and astronauts they are bringing to space station would die. And I think a lot of us know what's going on with Boeing these days. So it's really important to me that people be able to comfortably say when they made a mistake and other people don't jump down their throats for it. So I think transparency is a big key to an effective organization. And then I also want to address that I have not attended previous board meetings. I've been spending the majority of my time attending the Mendocino County Board of Supervisors meetings, and that is like almost a job within itself. And one night I actually pulled an all-nighter and I did a spreadsheet of the salary of every CEO in every county in California, except one, because for some reason that one wasn't published. I pulled it on letter, I put it in a spreadsheet because I wanted to bring it up for the vote for the CEO's salary. And I was the only one who called in. For the record, I objected to the raise because it was in the top third of California, and I didn't think it was commensurate with Mendocino County budget. But it got voted for, mostly I think because of lack of participation from the community. But I did the work. I spent all night doing that. So even though I haven't been in meetings, I have been I've been very strongly an advocate of participating in the community. And I think my past experience shows that I care immensely about the community, even though I haven't been to the meetings. And I think I can contribute to the board in many ways, which I've mentioned to you guys, which is AI, technology, potential hackers. And another thing is natural disaster, which I care very dearly about. And I run the Facebook page, Mendocino County Preparing for Disaster, which I started after the 5-day power outage that we had, and I was a member of CERT. So, okay, so sorry, that's my introductory statement. I thank you so much for allowing me to say it, and I welcome your questions for my experience in the healthcare system, my experience as a leader, my technical capabilities, and whatever else you think I can bring to the table. So again, thank you very much for letting me say that.
And again, we're trying to do these open-ended because we want to hear fully from everyone and get their thoughts. Was why do you want to be on the board? But I think based upon your statement, I think we have an understanding of that. So I'm going to go now defer to Director Savage for the second question.
Okay, my question is, what is your understanding of the mission and role of our elected board?
Well, I've read your mission right off the webpage. So the gist of it is to provide continued services and to improve services, especially to the more rural communities on the coast. Secondarily, I can't remember word for word what it said, but I know there's a strong impetus on financial responsibility. Let me think. I tried to address them in my, those are the first two off the top of my head, and I'll think further as you ask me the questions. But I think the primary goal is to make sure we're providing adequate health services to the coastal community.
By the way, I want to mention, nothing to do, of course, with our interview in the Stockholm. You see my cell phone on the table here. I have people have wondered in the past what that's about. I'm going to tell you that I have somewhat impaired hearing. And when I get to these meetings, I use this to adjust the volume so that I can be, so I don't miss things. So if you see this on the table, it's because I'm adjusting the volume of my hearing aids.
Cool.
Okay, so let
don't why I'm wearing a mask.
Yeah. Okay, so just want to make that clear.
Thank you.
Director Katza, for your question.
What's your vision of what healthcare should or would be like in about 5 years from now here on the coast?
That's a really big question. Because as I've tried to communicate, I have been through a lot in the last several years, first on the coast, and then because of what happened to me, I spent 11 months in hospitals and skilled nursing in Sacramento. And now I'm back here, and I've been in hospitals. I've been in the Coast Hospital here, as I mentioned in my letter of interest. I spent 3 different visits in UC Davis Medical Center. So I've experienced them and their procedures and their portals and things like that. I spent time in 2 different skilled nursing facilities, which were very bad experiences, I'm sorry to say, and 1 time in a boarding care facility. And so hence my interest in advocating for everybody and bringing my personal experience and what was good and what was bad. And on the patient side, how to deliver better services. And on the governance side, how to make sure that the I's are being dotted and the T's are being crossed. And making sure that we're all adhering to the Affordable Care Act, Patient Bill of Rights, and the California State Bill of Rights. Because I saw all along the way some places where it was not being done.
If you would please answer my question, which was, what's your vision of healthcare on the Mendocino coast 5 years from now?
Oh, I'm sorry. Okay, I would like it to, I think I share the community's desire to make sure we maintain the hospital minimally, because if the hospital goes away, we're all screwed in every sense of the word. Our property values, our housing here, the whole community. So minimally, we need to maintain the hospital and the services. I would like to see an improvement in services to make sure we maintain what we have to the people more rurally now, and make sure they're aware of the services and make sure we can improve and maintain them. I did try to find out, for example, the community outreach notes, and I don't think they've been published for the meeting so far. And I was not able to attend those. So it's just bringing my experience to what happened and to make sure, based on that experience, that we can improve the situation. I can speak hours on details, if you like.
I was looking for vision, but I'll accept your answer. I'm good enough with that.
I'm trying, yeah, well, my vision is better, but it's very detailed based on what I've been through.
Okay.
Thank you.
Okay, thank you. Let me then go on to our final question, and unless the board members have their individual questions
Yes,
they
I
wish
have
to
an
ask.
individual one.
So do you have any questions? You want to do your individual question
Yeah,
now?
and they should do the
Oh,
end, yeah.
okay, go ahead, Director Savage. Please.
Okay, and it sounds like you have been at least aware of some of the functionings of this board. And so I'm curious about, given the past dynamics of this board, what experiences do you have that show what you would bring to the board to help us work together more cooperatively?
Okay, that's a very good question. Thank you. It's a multifaceted question. One of the things I try to highlight in my letter of interest is working with teams and being collaborative, and transparency that I did mention in my opening statement. So that's number one, always. People need to be able to say what they think and not have any politics associated with that, and even vote a negative if they disagree. Not that I would. Sorry, say I'm thinking off the cuff. Please repeat the whole question again.
Given the past dynamics of this board, what experiences do you have that show what you would bring to the board to help us work together more cooperatively?
Okay, yeah, so, okay, when you say that, it brings my mind to the survey. And I saw, some things that are not great in the survey about how people don't trust the board, they don't trust the finances, they don't feel like the board is serving them. And so that's why I'm really glad that you guys are having the community outreach. And I would like to see the responses thus far. And one of the things I was curious about, and I couldn't get an answer to before the meeting, was how were people notified about it? What about people who don't have internet or cell phone? Like, were there flyers in stores and fire stations or something like that? Was there USPS? So I think it's important. Like, I'm a tech person from Silicon Valley, so I have like voice over IP, Wi-Fi, yada yada yada. But I don't have cell phone service, and a lot of people in the rural areas. I would like to know that we're focusing on making sure we're reaching all of the people in the rural areas on the coast, and they have a voice, and that we're able to adequately serve them, and especially in an emergency.
Director Savage, do you have a question you would like to ask? I mean, Director Katzoff, excuse me.
I'd like to know, what do you think about, how do you think AI will impact healthcare 5 years from now?
It already has.
Excuse me?
It already has. I think
Give me
if
an
we are
answer.
not doing AI now, it is already impacting us negatively.
I'm talking about the future. How do you think AI will impact healthcare on the coast in 2029, 5 years down the road?
The current prediction for 2029 is they keep saying it's going to be smarter than us by 2029.
See if you can tell me what you think it'll be like.
That's my lead statement. It is supposed to be smarter than us by 2029. I have been involved with it since OpenAI introduced ChatGPT last February. So I spent my time when I was in skilled nursing and et cetera. I took the classes. I've been on ChatGPT since it was first introduced to the public. I've been a paying member. I'm now a paying member of GPT-4. I'm a paying member of Grok. I'm not yet paying for Google Gemini, but I'm using all three. I'm sorry, I'm a little bit long-winded, but it's a big answer. So if we're not using it now, we're a year behind. And GPT-5 coming out this summer is going to be able to do incredible things.
And those
specifically, I use it like practically every day, so I'm very familiar with it. Specifically for medical, it's already being used to scan medical information, medical pictures, diagnose skin problems, like come up with solid diagnoses or solid suggestions. So the thing with GPT is with AI is you kind of have to understand how to use it. It can give you answers, it can give you suggestions, but it's still up to the human to think and decide what's right and what's wrong. But it's an incredible tool to lead you in the right direction, or sometimes the wrong direction. And that's what I would like to help share my experience with the board and the people in the county. Is I've seen it go both ways when I've used it. And you have to be very careful how you use it, and you have to know which tools to use. But in 5 years, it is predicted to be smarter than humans. And that's a big deal. It's GPT-5 introducing this summer. It's going to be huge. I urge everybody listening now, get on GPT-4 and start learning, because it's a fire hose of learning and information that I've been working on, since February of last year now. If you have more specific questions about how to use it, I'm happy to answer them, but it's such a big question, it's hard for me to say anything more than it's a great diagnostic medical tool. I know a social worker, and I showed her how it can help her in her job as a social worker. It can translate languages. So you can have a document, you can translate it in different languages, but then, of course, you have to have a native speaker make sure it got it right, because you always have to check its work. But it's so powerful. I would love to spend an entire evening just talking about it and teaching people.
Okay,
So
thank
I'm
you.
sorry, but it's not an easy, quick answer.
Okay. Ms. Stockel, let me, final question is, do you have any questions for us?
Yes, one thing, well, I did, when on looking on the website, I have two. Is there a job description?
I'm sorry, what was?
Is there a job description?
This is not a job, it's an elected position. It's an elected official, so we don't have a
Is there
job
an
description.
outline of qualifications that you, based on your experience, that the board is looking for?
No.
Okay. Yeah, well, so, okay. So I guess that's one reason my answers are a little bit open-ended, and I've tried to cover the bases as I see them.
Well, we ask open-ended questions because we want to give every candidate the fullest opportunity possible to tell us about themselves. So that's our
Right.
intent.
I wanted to learn about the board, and I couldn't find anything on the website other than email addresses. And by the way, how do I say it?
Okay.
Your email is bouncing.
Okay, well, thank you very much for
Well,
your,
so I just wanted to hear what you were expecting of the board member, and I would have liked to have heard from any of you what you were expecting of the board member, and why you're switching horses, 3 months after your elections.
Okay, this is just speaking for myself and what I was hoping to see. What I am particularly looking for is people who are willing to spend the time, people who are willing to listen to each other and learn from each other, and together solve some pretty complicated problems that we face as we work to improve healthcare all along the coast. And further specifics, I think that those general areas in my mind would help us work together to define what exactly we're doing in pursuit of those goals.
Okay, I like to hear that, and I think I covered that in my letter of intent and resume. And
Okay.
if there are any holes in that regard, please ask me.
okay, Ms. Stockel, we now have to move on to our next candidate. So again, appreciate your time and your appearance tonight and your interest. And with that, let's go on to Mr. Hart.
Thank you. Thank
thank
you very
you.
much, and I hope you heard my enthusiasm.
We
Okay.
did.
We did. Okay, Mr. Hart, thank you for coming this evening. Would you begin by telling us why do you want to be on the board?
Or did he want to make an opening statement,
What?
to be fair?
Come on.
The first question is an
Got it.
open-ended one.
You're okay?
I'll answer in two parts.
All right, that's how I did.
You did pretty good.
And I'm sorry, I can't mute her. Ms. Stokel, would you mind muting your computer, please?
Oh, you heard that. Well, I said something good. All right, thank you. Sorry.
I'll answer in two parts. Quick thing about my background, and second, why I'm interested. For my background, I spent 10 years fixing up downtowns. To me, typically as a consultant coming in, and broad range of issues we faced. You'd come in, typical engagement for me was 2 years, 3 years. So we would come in, understand what was happening, what was needed, come up with solutions, and often come up with how to pay for it. Because a lot of times consultants would just simply write a
I'm
report.
sorry, but this can't be heard over the Zoom.
His mic isn't on. Sorry, Kathy, I'm trying to message you. Your mic isn't on. The microphone isn't on for the public.
Okay, we've got our AV, Marshall.
Thank you.
We're okay?
We're good.
Okay,
All right, cool.
sorry, Mr.
That's
Hart.
fine.
Sorry.
Perfect. Thank you.
So for me, it was coming up with solutions and how do you pay for them. After that, I spent the next 25 years, after my brother asked me to join for a railroad. We started off with 2 employees, now we have about 240. I have a lot of experience doing this. It's not easy, it's not hard. We've made good decisions, bad decisions. We've made decisions people may question, but we've had a lot of success. We've had a lot of compassion, and I stand behind the success of what we've done. I think we're a credit to California. And I'm sorry?
I'm sorry, may I interrupt? Just, you keep referring to we, and I
Oh.
would just like to know who the we.
Oh, the Sierra Railroad. I'm vice president of the Sierra Railroad Company, which also owns the skunk train here in town. So for me, along the way, I've been involved in many things, lots of boards, lots of commissions. I know there's a question coming up a little bit about the boards and commissions. But for me, I've been involved in vice president of, there's some issue?
No, I'm sorry.
Oh, okay,
I'm
sorry.
sorry, Chris.
Oh, that's all right. So along the way, I've been involved in vice president of chamber, vice president of YOLO Visitors Bureau. I've been on the State Marketing Commission. I've been president of a variety of things. I think it was 15 different commissions. I tend to get very involved. I'm not someone who sits on the sidelines. And so coming to the other part of the question about why I want to do this, I've always been one where I see if there's a need, I'll try to do something about it and get involved. To me, I believe the coast desperately needs the hospital and the healthcare district, and it needs to be a long-standing future. And to me, it felt like it was in question. And if I can help that, then I wanted to get involved and see what I could do. I'll say right up front that I don't know much about medicine. I don't know much about the medical field. I learned a long time ago when I got involved in a railroad with no experience that it's important to know what you know and know what you don't know. And you'll find with me, if you have questions, I'll be open, direct. I'll tell you what I know. I'll tell you how I feel. And if I don't know what we're talking about at all, I'll tell you. So in this, for this interview, I'll try to do my best and address your questions, but I do feel I could come in and be an asset to the board and to the community.
Okay, thank you. Director Sanders.
Okay, so what is your understanding of the mission and role of this board?
I saw I think there was 3 main bullet points about the caring for the resources and the programs and all that. But I'll tell you, as I read it, as with many mission statements, it was very open-ended. And as I was in the community meeting I think it was last week or 2 weeks ago, I remember just being quite taken with this board could go so many different directions. There's the hospital, but you're also in so many ways looking after the entire region's healthcare. And to me, I don't know what level of tactical decisions or what sort of agreed upon areas of emphasis or goals or things to focus on. I think it'd be critical to do that. And maybe you already have that and I haven't picked up on that. But to me, I think it'd be so important because to me, as I sat there thinking about if I sat on this board, what would I do? You could go 20 different directions. And so to me, it does seem like there's some critical things coming up, such as the retrofit for the hospital. I think the board needs to focus on that. But if I got on the board, I would go off 6 different directions. I think it'd be important to understand what's important to the entire board. Yes, some board members can have individual priorities, but there's also, more importantly, group priorities. So that's what I would, so in answer to your question about the mission statement, mission statements are good. You have to pay attention to them. But it's what comes after the mission statement, which I think is the most important. And that's what I would like to work with the board if you guys selected me.
Thank you.
Director Katzeb.
I want to combine 2 questions in one. The question of vision for 3 to 5 years down the road, and combining that with you talking about the possibility of us having 20 different directions possibly. Give me 3.
Sure. In terms of the vision, I'll say two things. One, it sounds like there needs, in 3 to 5 years, I think there needs to be greater confidence in the board. I don't know the board members. I don't have that much experience with the board, but it seems like there has been issues. And so to me, a goal would be in 3 to 5 years, people would feel better about it. In terms of the area in 3 to 5 years, what I'd love to see would be greater enthusiasm for medical care here on the coast and greater enthusiasm by the employees for the situation they have. I'm not saying they're unhappy, but it seems like that would be a great goal. I've talked to many of the people in this area, and if it's between housing and this, that, the other thing, if we can make it better for them, that would be fantastic. So that's that's the short answer. Now, there was a second part to what you asked.
It was,
Remind me, there was
you
one.
mentioned that you saw so many different directions that we could go to, and I figured, okay, give me 3.
Oh, yes, yes. To me, some of it will touch into, I know this AI and things like that were touched on. We may come back to that. But to me, there are so many people who leave the area for healthcare visits. And whether that's because they prefer other hospitals or because of the healthcare plans that they have, or because they have to go see a specialist or something like that. One of the things that occurred to me is that it would be great to recognize that there are a lot of people who need to leave the area or want to leave the area. So why not embrace that? Why not have a remote communications room? Have perhaps a nurse or technical support in there. And they could be then meeting with a doctor specialist in San Jose that they need to, and so they don't necessarily have to drive so far, but rather than sitting in their living room on Zoom talking to them, now they could have a facility and the ability to have tests done live while in communication with a doctor. I think that sort of thinking would be where, and again, maybe this is all stuff that's in the works for hospitals, but that's something that seemed to me that with the Mendocino coast being so remote and so many people leaving the area for healthcare, I would love to make it easier for people to do that with maybe not even leaving the area. So that's one.
I have one other.
Please.
You talked about controversy.
Sure.
You're one of the most controversial people in the community. Not you personally, but the issue, but the railroad.
Yes.
And all. So how do you, if you've been unable to avoid controversy with something that you have so much experience in, and if you're so community-minded, as you say you are, and I believe that.
Yeah.
We all have different ways to be community-minded. What benefit would this board have to have somebody so controversial in the community bringing that controversy to the board?
Sure. It's a fair
And
point.
I'm sorry if that question is...
No, it's fine. Now, you'll find with me, I'll talk about anything, and so no harm about that. But I will say, if you don't want me to ever talk about my company again while on the board, that's fine. That's not why I'm here. My company has nothing to do with it. I think that I could be an asset for who I am and my experience. As far as why, talking about if I have all this experience, why hasn't it gone better here? I would probably need to, talk for about an hour and a half about the pros and cons and how this happened, but there's no short answer to it. So I feel like I'm ducking it, but I don't want to, but there's no easy answer for it. In general, I've had a lot of success in this field elsewhere. It has not happened here for a number of reasons.
Good enough. It's a good enough. You don't know what you don't know, and you do know what you do know. That's
Yeah.
good. That's what you were there before.
But if anyone wanted to talk to me, I don't think I've ever ducked a meeting here on the coast. I think I've offered to probably 25 of my critics to sit down and meet with me, and not a single one has. I think there's a lot of people who want to criticize and not talk. And you'll find with me, I'll talk through the issues. I have no problems talking through controversy. I'll do the best I can. So.
Thank you.
Director Savage.
Okay, so, given the past dynamics of this board, and it sounds like you are somewhat familiar with that, what experiences do you have that show what you would bring to this board in terms of how you can help us work together more cooperatively?
I mentioned I've been on a lot of boards and commissions, and I just, through my experience of, there's times for brainstorming, there's a time for controversy, there's a time for conflict, and then there's a time to get behind things and move forward. I would like to think that in my experience working on various boards and commissions, that I know how to work through that process and how to achieve a more effective board. Because there is time for individual ideas. And I'm not saying that if you lose a vote, you should give up on your principles or your ideas on something. But I do think there's time to make a decision and get behind it and move forward. And I am a team player who will speak my mind up until the point where it's no longer supportive.
Okay, and then Mr. Hart, final question. Do you have any questions for us?
I don't.
Okay, any? Okay, thank you very much. Okay. We have a need for a bio break, so we're going to take a 5-minute recess, and we'll be back at, let's make it 5 minutes to 6. It's, I want to call the meeting back to order.
Recording in progress.
And
And,
my
uh,
apologies, Gabriel, but I drove for 5 hours to get here, and it was
She
urgent.
raced to
I
get here.
really tried. I'm sorry.
Okay, Mr. Maroney. Okay, Mr.
evening.
Maroney, our first question tonight is, why do you want to be on the board?
Is this good? You can hear me okay?
I think the concern is from the audience, Norma? Okay, good.
Well, the first thing I would say is I am personally very passionate about healthcare specifically. And I also wanted to open up by saying that anyone who is passionate or interested in this, and here's my voice, such as Chris Hart, and is or is not selected, should still be involved. There's openings on the Measure C committee, there's all kinds of opportunities, and I hope that the board will open other opportunities for our community to be involved, such as different committees and so forth. I really see I call it the Trident approach when it comes to the healthcare district, as far as, and it's kind of like past, present, future, but I see how we have to preserve what we have and make it stronger. We also have to understand what we have and what weaknesses we have and the lack of different healthcare modalities and how to fill that gap. And then, as mentioned before, what comes in the future and where do we move in the future? My formal training is in public health. As you know, I have a master's degree in global health, and I'm really interested in, what they call alternative medicine or herbal medicine and naturopathic medicine. And I've also been trained in research and understand a lot about, the pandemics and statistics. And so, although I don't think anyone on the board needs to know a lot about public health, I think that it would be a benefit to have someone on the board that can give you that insight, and not just, look at AI and be all googly-eyed, but be skeptical and give other opinions about certain things. So, to answer your question, I've always been very passionate about healthcare, from my training at age 18 and hypnotherapy to herbal medicine to naturopathic medicine and healthcare.
Okay. Yes?
Okay, so what is your understanding of the mission and role of this board?
Well, again, I believe the mission started off with to preserve emergency healthcare and kind of critical medicine originally, and to have a hospital here in this rural area, and then kind of opened up further into general health care. I understand that the board ends up being landlords to different buildings, and so from financial to different building management to healthcare, it's pretty wide.
Director Katzif.
Well, what do you think about community health in the next 5 years? What's your vision of a better healthcare community going forward?
Going forward, I have many visions as to what should be included in healthcare. Obviously, increasing access and agency to specialists here, telehealth, and making sure we keep the hospital and expand that out. But my vision, I'd like to see different programs being developed with universities to working with the forest managers and developing natural products locally. And every single institution, I'm working on trying to get the city council to do a healthcare ad hoc committee as well, should be involved as we move forward. And so I could see this board even being potentially working on legislation if needed. And we really need to, after the pandemic, we are really in a different state of affairs, and I believe this is a perfect pivotal point in time to re-envision healthcare. So I'd love to see a naturopathic university work with a UC or work with Adventist Health and have a lot of collaborative medicine. I know that it would be excellent if we had different areas of hubs of information. I like what Chris Hart said at one of the meetings where people have different addictions and we need to help them, get help for certain addictions. But people also need information and where to go, and the flow of healthcare is really important. So for everyone here in this area to know that you should have flight insurance and things like that. So I think that we need healthcare hubs, and this district can be involved in that and to educate the public. We could have seasonal workshops as well as fairs that are based on health and well-being, because the more we're informed and the more we go upstream of health, the better that our health is going to be. It's one thing to focus on the hospital, super important, but we also want to avoid getting these diseases. So I've, in my master's degree, I've worked on things like creating new professions like doctors of natural pharmacy and all kinds of out-of-the-box things like that, because I believe that it's our duty to really forge the new way. And so that's why I don't count out working with the forest managers when it comes to our health. I don't count out working with any institution within our range.
Okay. Okay, I've been directed to make an announcement that the closed session is moved to 7:15 in a special meeting agenda? Okay, the special meeting agenda. So that's just a general announcement. Okay, Mr. Maroney, I do have a question for you, a very practical one. And I like all of the discussion about the future and all of these alternatives, which are very exciting. And I get a lot of push from that and additional and passion from Director Katzoff when we talk about that. But we will need to consider the question of retaining our contractual relationship with regional government services in the near future. In the past, you've been very critical of regional government services throughout both our process of bringing them on and then more recently. If you were to at the point where you would need to vote on retaining or dismissing regional government services, how would you vote?
Okay, well, I disagree that I've been very critical of regional government services. I did say that specifically when it comes to the survey that was set out, that I wasn't sure if it was worth the money. I did. Well, let me just answer the question.
Hold it. Let's not get into the survey. That was EMC Research who did the survey. That was not regional government services.
No, but he was saying that he was critical about something
Right, okay.
other than...
Right, so your characterization isn't really accurate in my opinion.
Okay.
I mean,
well, please tell me.
As far as any vote that would be coming up, I don't know. I think that I would have to hear and understand what's going on at the time for that kind of vote. I'm not sure if it's appropriate, actually, to even answer that question.
Well, we will be on that in the next couple of months.
Excellent.
It's right upon us.
Yeah.
Okay,
Can I
and
ask
then you have your question?
Yes, okay. So I appreciate the fact that you've been here with us, logging through a lot of difficulties and dynamics over the past number of months. So given the past dynamics of this board, what experiences do you have? And I'd really like to hear specific experiences that show what you would bring to the board to help us work more cooperatively with each other.
I appreciate that question, and I can give you some really solid examples. I was on the the committee when it came to the name change of Fort Bragg. I've been on a bunch of committees that are actually very controversial. And I think if you spoke with anyone that had anything to do with these committees, they would say that I was a positive force in bringing out and listening, as you mentioned, being able to listen to what everyone's saying and being able to synthesize a solution. And I'm very proud of what we came up with in unanimous in such a contentious matter, that we came up with excellent results, in my opinion. I also worked on, when the Marine Life Protection Act agency came to town, another very contentious, kind of like the fishers versus preservation. And we had to strike a balance between how much you preserve and how do you protect the local fisheries. And again, I took a mode of, taking both sides and how do we bring it together and find solutions in that way. Let's see, I think I had one more, but it's slipping my mind. So I do believe that elementally, in fact, I wanted to start a political group called the Quintessence Party that brings the best aspects of each, whether it be conservative, liberal, Green Party, all of them together and bring them and say, what are the best aspects that we can synthesize solutions? So that's kind of how my mind thinks. And I will challenge someone if I think it needs to be challenged. I'm not just a pushover. And I think if something needs to be heard, I think that I'll voice it, but I'm not disrespectful. And I'm not here to demonize anyone. I'm also not here to praise anyone for no reason, but I am here to support everyone in a constructive manner. And I think I can do that very well.
Okay. Director Katsup, do you have your question for Mr.
Yeah.
Marone?
No, I don't think, I'm thinking about, well, tell me your thoughts about alternative or non-mainstream therapeutic models of health therapies.
Yeah.
What is your scope of that?
Well, and again, if I was selected, I would also want to be a mirror of the constituency as well. It's not just what I come up with in my head, it's like we're here to represent the people. And if you look at what the people have been calling for a long time, it really is a lot of these so-called alternative medicines. If you look at during the pandemic and coming up to, one of the biggest industries is dietary supplements, herbal medicine, and these so-called alternative modalities. Now, in 1910, the Flexner Report came out and said there are too many doctors, and what ended up happening is they shut down black and female colleges and also decimated herbal medicine, where we had a rich history of herbal medicine in America. And then also with penicillin, when it came out, they used to farm herbs up and down the coast in Oregon and California, golden seal. It was a huge economy. Penicillin came out and everyone goes, oh, penicillin, it's this miracle thing, and kind of forgot these things. But if you look all around the world, they've been using, and I'm just using herbal medicine as one modality, they've been using this for thousands of years, and the science backs it up. So again, when I got my Bachelor's of Science in Herbal Sciences, and previous to that, when I learned that you can actually grow your own medicines, well, if you think about our area as an island, and you want to have health sovereignty, you're going to want to be able to grow your own food as much as you can. You're going to want to be able to have access to medicine as much as you can. I think there's a problem with how most of our medicine does come from China. I have no problem with China, but we also want to make sure that it's as efficient, that we can trust it, and that it works well. So I really think that this is going to be a huge thing, especially with mental health. There's the psilocybin that's been popping up a lot, the cannabis thing. All these things have been suppressed, and beyond cannabis and the mushrooms, There's thousands and thousands and thousands of, different lichens and plants and mushrooms that, and also things in the ocean. So that's why I truly believe that even this board should be involved with working with the forest, connecting to scientific labs. We here could develop a cure for COVID, maybe from the redwood, or who knows what compounds we could find. So again, I'm using that modality as an example, but when it comes to any of these things like yoga, different exercises, meditations, they're very beneficial to the health when you have positive habits every day.
I want to thank you for speaking so fluently on the subject. I knew you would, and I was searching for the question that would get you to open up this conversation to
Right.
those issues, so thank you.
Right. And also speaking to the collaboration, I do have a positive relationship with, the city, state representatives, the forestry people. So I have been going around because it is my passion. And although, as I mentioned in my write-up, I am physically disabled and I'm often in a lot of pain from a spinal injury, but I still show up to these meetings, even though I'm constantly in pain. But my point is that because it's my passion, I have developed these relationships because it is my duty to affect medicine as best we can for the coming generations and for all of our family members. I have personal stories of my aunt, being flowing out on the $77,000 plane trip. There weren't beds. I want to go at every point. Why aren't there beds available? Do we need to look at legislation? Do we need to talk to people in the Bay Area? Whatever it takes is my concern. All hands on deck. And we need to bring in as many people as we can and as much talent as we can, and I'm here to try to do that.
Mr. Maroney, let me just comment that I do also appreciate your passion very much, and I also want to thank you for the work that you've done on behalf of the healthcare district of the past, and particularly your participation now in the Measure C committee.
Yeah, thank you, appreciate it.
Yeah. So at this point, do you have any questions for us?
I have one question. Have you, the idea of doing like a contest for the symbol of the healthcare district? So, have you guys gotten that started? My question is, what are you guys going to do, and gals and people, to bring in the community and really make it feel like when someone comes up here and says something, that you really think about it and take action on it? And how can we do that? Like I mentioned, seminars, fairs, different. So that's just my question to you, not for an answer necessarily right here, but to think about how can we open this door, to who we need to open it to, and have more people come.
Well, of course, I think, if I speak for the other board members, we'd all love that. At this point, we have been working very hard at creating appropriate infrastructure so that we could operate efficiently. We have a huge responsibility to our taxpayers in this district to handle their funds efficiently and effectively, and that has been quite challenging to get us to the point where we're very close to that. But at the same time, I would observe that, as you know, because you attended them, we've conducted three, or did we do four? Four community listening presentations.
I was there at all of them, even the Spanish one at the very end.
You absolutely have been, and we have three more coming, so that's, I would also like you to know that we have a community forum scheduled now for May 30th, where we're going to be hearing from the research done by the California Center for Rural Policy on healthcare, the health of Mendocino, and of course the other counties as well, but focused on Mendocino. Included in that will be, as one of the panels, will be Dr. Miller, who's with us this evening. So we are making baby steps in that direction. I constantly get pushed again by Director Katzoff in that direction, but I am confident that he has some excellent ideas. So I guess that's the best I can say about that. And I do think we want to be more inclusive. At the same time, we have to make decisions. because we make decisions that people don't like, doesn't mean that we don't listen to them. It means we just don't agree.
Right.
And that's part of democracy, a very important part of democracy. Okay. But any more questions for us at this point?
No, thank you.
Okay, thank you very much.
I appreciate it.
Okay, so at this point, I'd like to ask board members to write their choice on a piece of paper and present it to Secretary Savage.
I want to say something, Will. Can I?
Sure, absolutely.
We have 4 members on the board, and one of our members chose to not be here tonight, which means that in order for any one of the 3 of you to be appointed, you have to be appointed unanimously by this group, because you need 3 votes. We only have 3 of us. Or do we have 4? No, we have 3. So just keep that in mind, and it's very disappointing to me to know that that situation exists for the 3 of you. I think it's unfair, or at least skirts on unfairness. That's all I want to say.
Okay, this is you, so I'm putting you. Okay? Okay, how would you like me to,
Go
just
ahead.
to read the ballots?
Oh,
Okay.
I need to have a public motion or second? It can't be.
I do not believe it can be a secret ballot.
No, it's
Oh, no,
not a
we're
secret
going to
ballot.
reveal the
We did
results.
this last time, and it's not a secret ballot, just that rather than influencing each other with verbal votes, et cetera, what we did last time, and we're trying to be somewhat consistent with what we did last time. We have paper ballots, and it will be who voted for who.
Thank you.
And I'm going to announce that. Okay, so this is Paul Katzeff, Gabriel Maroney, and Paul Garza, abstain, and Susan Savage, abstain. And I don't know if there's an interest in why, but I could say what I.
Okay. So at this point, we fail to have enough votes to appoint an individual. Ms. Wiley, what is the timeline that we are now facing? What was the actual date of the resignation of?
Yeah, Lee resigned on the 29th of February, and the effective resignation was March 1,
March 1?
and it's 60 days from March 1, inclusive.
As of,
31, so it's probably going to be around the 27th or 28th
Of May,
of April.
April.
okay,
Well, that's
okay.
tomorrow.
It's tomorrow. Okay. So it appears that then this will, by statute, this decision will have to go to the Board of Supervisors.
Unless you want to call a special meeting to do something else. Yes.
I would like to make a motion that we call a special meeting to, if that's in the rules, if we can do it, if you're correct, because I don't want it to go to the Board of Supervisors, which it will do. And I don't know what the Board of Supervisors will do, but I want it to be in our hands. So I made a motion to have a special meeting, if that, to extend the time until we can have a fourth board member to vote. And perhaps we'll be lucky this time.
Okay, just a point of information. So that would mean that it would need to be on either the 26th or the 27th, then, correct?
Well, I guess we could count the dates. It's going to have
The
a calendar.
29th is day 60.
That's Monday.
Yes.
And do we have the ability to consider additional candidates by that date?
I don't know, is the answer.
How much notice needs to be given for a special meeting then?
Special meeting is 24 hours notice.
Okay. So we have a little bit of time to do some research to find out what our prerogatives were. We could call a special meeting, and I'm going to suggest the 29th, although I think I have a note here, that's Sarah's birthday.
Well,
So
in
hopefully we
addition to
could get
that,
her-
I will be in Arcata on the 29th.
So we may have difficulties finding a date that we can do, but we could try.
We
The
could have to
29th
be
is
Sunday.
what day?
29th is a Monday, next Monday?
I will be in Arcata.
Will you be in Arcata on Sunday?
No. Well, I will be traveling up there Sunday evening, but.
Evening, but during the day maybe.
So it's possible we can have a Saturday meeting? I would have enough notice for that.
No, I have another thing I'm doing all day Saturday at my house, so I don't have a choice to
Well, we
not.
can have it at your house.
Along with 20 other people that are coming for a meeting at my house.
So Sunday would be possible. That would be a little extraordinary, but what a better way to spend a Sunday.
All in the line of duty.
Well, and check with Sarah to make sure that that works for her. Or if she wants to spend part of her birthday with us on Monday, before Paul goes to his thing.
I will
Okay.
be in Arcata
All day,
on Monday.
okay, got it.
I have a commitment. I am on the Equity Council of the
No, you
California
don't have
Jobs
to
First
explain.
Rise,
Yeah.
and I have to be, I
Got
have
it.
to be in a meeting.
No votes are voluntary. You don't have to explain your no vote.
Okay, we will be in communication quickly as soon as we can tomorrow with everyone to sort this out. But at this point, I'm going to close this portion of the meeting and go on to our regular meeting of the Healthcare District. Okay, and let's go on to our regular agenda. So we will begin for public comment. Recognize anyone for public comment at this time. Okay, Mr. McDonald.
Thank you. I'm going to say the two-word phrase that I used in that email to all of you, and one of them, dysfunction junction. That's what we have here. A, no roll call when you open the meeting, no comments from the public before the interviews, no participation of the public during the candidate selection process. In other words, you attempted to take an action without public input. That's a no-no. Regardless, Mr. Garza stated that this is how we did it last time. He was present in September. Apparently he doesn't remember me asking a question. It was kind of the usual elongated Malcolm comment followed by a question. You know, you guys just, you know, I'm amazed that you're doing a public comment now. I'm forgetting some of the things. The last regular meeting, there was a question about consent calendar and not allowing public comment for the consent calendar. I told you how to do it. I told you to look at the Fort Bragg City Council agendas. We have the same setup here. Mr. Garza was told by other outside officials, I could read the emails if he'd like me to, about the mistakes on the consent calendar. He said he would correct it. There was a whole, I'll save it for some article in the paper. He's just directly flying in the face of what a good leader does. Seems to me he's just concerned about public image, et cetera, and control. All things must be controlled by him. Look at that internal controls policy. It's just, you know, gosh, I've been here before. You know, I've asked for, as Linda remembers, I've asked for everybody on a previous board to resign because it would be best for the district. I'm not going to say that now because I don't think it applies to everybody. It's just ridiculous. There's so many things, just so many things. You know, a Public Records Act that's still, I understand by looking at the warrant list, it is being worked on, but we're 13 months later on more than 2/3 of it. You know, and the dysfunction junction for the public, when this agenda is a total screw up. We had an agenda on Monday that had the closed session in the middle of the meeting, which can happen occasionally, but no reason was given for it. Wednesday, 4:30-ish, we got an agenda that said there was going to be a meeting that night. Well, it was mislabeled. It had Wednesday, but it had today's date. 25 minutes later, we get another agenda that has a special closed session meeting for tonight at 7:15, but no explanation as to how it fits into the regular meeting, the candidate interviews, etc. No explanation about it other than in the middle of the candidate interviews, the chair tells us that there's going to be a special session at 7:15. Obviously, that wouldn't qualify as notice, but I mean, anyway, it's just way too much. I appreciate some of the questions. Mr. Katzeff's question to Mr. Maroney. Mr. Hart gave good answers to things. But you guys have got a long way to go. Your credibility for some of you is just, I don't know, thin ice isn't quite thin enough.
Are there any other public comment at this time? Okay, thank you. Then let me,
I have public comment, please.
okay, sorry.
This is Anna. I have public comment.
Okay. Yes?
I have not been in the meetings, as I already admitted, but I have researched them in the past. And I know Mr. McDonald has been, spent a lot of his time attending the meetings and contributing, and I share and understand his frustration, and I think he's spot on. And I myself have frustration with this meeting. This was an important meeting tonight, and it was on the calendar, not only that we would each give an opening statement, which then, you know, for some reason was trying to be swept under the rug. I don't know why, you know, in which I spent a lot of time. So you did give me that opportunity, but that changed. And I agree with him on, you know, the agenda changing. And this is so important. And a board member doesn't show up and you don't have a vote. Because the idea clearly in the agenda was we're going to vote. And if we come to a consensus, we're going to swear somebody in tonight. And then there was 15 minutes talking about when you can do it and somebody's birthday, for crying out loud. And I guess, you know, I that's why I share Mr. McDonald's concerns. And I guess that's also why I wanted everybody here. You know, I try to be a team player, but I'm also going to say what I think. And I am an outsider, which is maybe a good thing or a bad thing, but I don't have a dog in any fight. I don't have a train or whatever. I'm just coming from the outside, and I'm coming from my experience in the healthcare system. And if I were anybody else listening on this channel tonight, the public, I would be so frustrated as well that you guys couldn't get everybody in there and have a vote. So now you've heard my comment, and you're going to hear that I'm straightforward, but I'm not going to be insulting to anybody. And I understand, that most of the public don't call in. They don't call in to the Board of Supervisors meetings either. I was the only one on the call for the CEO salary. So it's good that we have some members of the community who are willing to hang in there and pay attention. Otherwise, all the boards would be free to do whatever they want. And so I'm glad that there are people who hold people's feet to the fire. So I want to second everything Mr. McDonald said. And I would like to hear, I didn't hear firmly what night you're going to reconvene with all of the members and there's going to be a vote. So that's my public comment.
Okay, thank you. Is there any further public comment at this point? Okay.
There are no other hands raised here online either, Chair.
I'm sorry?
There are no other hands raised here online either.
Okay, thank you. With that, let's
You're
move
welcome.
on to item 5. I'm going to call on Ms. Leach, as the president of Adventist Health Coast Hospital, for a report. And as
evening.
usual, we adjust the podium and the microphone.
Thank you. Good evening, Board. Thank you for an opportunity to speak. We're going to save most of our comments till later. Thankful that Dr. Miller is here tonight, as is Peter Johnson on behalf of Adventist Health. Just wanted to give you a couple of brief updates, as we always do, in regards to our operations. You'll be very pleased to know that our access to care issue continues to be the top priority. This morning, we started with an inpatient census of 19. That was in med-surg and in the ICU. We also had 221 patients that were scheduled to be seen in our clinics today. We had 52 patients in our physical therapy department today. And we had a host of patients coming in through other services, including oncology and other essential services. I share that with you to let you know that our continued growth to make sure we are meeting the needs of this community continue. That commitment is there. I'm also pleased to let you know that it's not all focused just on acute care needs. Part of what we talk about, too, is the prevention of disease. I want to thank Mr. Katsup for reminding us how important that work is. The prevention of disease, those are the conversations that we have with every patient that comes maybe for their annual clinic visit, which is so important because that's preventive care. The work that we do through Delphine Davidson in our wellness clinic, designed just for people to come in and talk about their well-being journey and the wellness aspects of their work. The work that Dr. Berna does with every clinic visit to ensure that we're not just talking about symptoms, but we're also talking about the prevention of disease. And so thank you for reminding us how important each of those aspects are. Finally, I want to remind you that the work that we are doing is also outside the hallways of this facility. And so that's the work in our community integration, the work in talking about how we partner with others. We will never be on this journey on our own. It will be us joining arms together to create a healthier community. But today I've given you some of the stats just to remind you that this work is about continued growth. When we began this journey, it'll be 4 years this spring, we had single numbers for our inpatient census. You'll recall last year that the report I gave you showed that over 10,000 people used the emergency department. You'll recall that nearly 38,000 patient visits were encountered in our clinics in this community. Those are staggering numbers. I'm also pleased to let you know that home care and hospice is officially happening on the coast. In fact, nearly 50 patients in our home care division, and hospice has begun. That is a certified hospice program. What will allow us to grow is the onboarding of more nurses in this community. We are also pleased to let you know that contract labor, that is travelers who are often needed to provide care has continued to decline, which is a good thing. That means that people that come to this community in a traveler position have chosen, in many instances, to stay here. And so they are what we call converting to being part of our permanent family. Why does that matter? Well, it goes back to making sure we are a welcoming community, ensuring that housing is available for those who are trying to relocate here, and making sure that we are providing competitive wages. I give you all of this information tonight in a place of gratitude to you and to our community at large here on the Mendocino coast, because this is the work that our physicians, our clinicians, and every member of the team does together. Today, we celebrated the life of an employee who passed away just a few weeks ago. She passed away on her way back to the coast. She was with her family. There were 2 children, her husband and herself, in that vehicle.
Oh, my.
And her life was taken during a head-on collision, as was the life of her baby. So today, our work family is reminded of the sacredness of life, that we're here today, but tomorrow is not promised. And what I love about being part of this family of healthcare providers is that we truly are a family here. We've got each other's backs during the hardest of days and during those moments of celebration. I'll conclude my remarks with that today.
Okay, thank you.
Yes.
Yes, please, Director Board, yes.
So, you mentioned that there were 38,000 visits. I'm interested in the number of different people. Was that 38,000 different individuals? Impossible. So it must have been some smaller number of individuals. How many different individuals made up that 38,000 visits? Because that, I can use 4th grade division to divide the number of people into the number of visits to determine how many return visits occurred. Although you probably have that number as well, so I wouldn't have to use my 4th grade.
You may have to, because I don't have that number off the top of my head of individuals that 38,000 visits includes, but we'll be happy to get that and get it back to you.
Thank you.
Thank you.
Any further questions, Director Scassa?
No.
Director Savage, please.
Can this be a comment, or does it need to be a question? Okay, I just have to tell you, because I really appreciate it, and I was writing down about that it's not just about acute care, that it's prevention and wellness as a function, and I wanted to kind of add early detection kind of to that list as well, because I am a big fan of this hospital, because I've had a couple of instances on a personal level of things that have happened, that having the ability for high level expertise and equipment to check on something that turned out to be totally fine, wahoo, but I didn't need to go to Stanford or someplace else. It was here on the coast that my family can kind of relax and not worry about me, because Adventist Health is here on the coast. So that was a personal thank you to you and also your facility, and add to your list of things that we're doing, that we're also helping people to detect things early so they don't become acute care issues.
Thank you, Director
Welcome.
Savage.
Thank you.
Absolutely, the work that we do, and I think of the work happening in our imaging department, specifically for mammography services. Being able to have that service close to home is essential. Today, in our imaging department, I believe the number that was reported out in our safety meeting this morning was that it was 122 people that were coming through that were scheduled today. Now, that's not just mammography, that's in other modalities as well. But indeed, that is one tool for prevention, and we're very grateful. Thank you.
Thank you.
Okay, I have been silenced by
Here, you can use mine.
by Marshall. Thank you. Thank you. Okay, moving on, my report is a simple one to the board. Chair report. We have been working diligently with our new CFO, Mr. Wayne Allen, to get our financial house in order. And we have now are able to report how much money we have in each of our bank accounts for the first time since July, so that's comforting. We also have been able to track some payments that are coming to the district. Most famously, the intergovernmental transfer, excuse me, the intergovernmental, what's the T for? I'm sorry. Okay. We understand is going to be returned to us on Friday, as well as we should be receiving a check from the county for the taxes this Friday. And because of the work that's been done, I'm stepping a little bit ahead in terms of what Mr. Allen is going to report, but I just wanted to second that. That has been absolutely essential to being able to produce a full financial report that we look forward to be able to present next month. But given the fact that we had some problems with access to our bank accounts, we're now at a point where we know the money that we have, and we can move forward. That has been the major thing that we've worked on in the previous time, and I think for all of you who are residents of this healthcare district, I think you can appreciate how important that is. With that, let me, board has any questions for me? Okay, hearing none. Ms. Wiley, your report?
Thank you. So just a couple things. The next listening session will be in Mendocino. I just got the date today. It will be May 15th at 6:00 p.m. at the Community Center of Mendocino. And plans for the ELK and COMCHI meeting dates are still in the works and should be announced in the next day or two. Additionally, the Community Health Forum will be held at the Fort Bragg Town Hall on Thursday, May 30th from 6 to 7:30. The keynote speaker will be one of the authors from the Humboldt State Report entitled California's Rural North, Evidence-Based Strategies and County-Level Best Practices to Improve Health Equity. That was dated November of '23. The local panelists from various medical practitioners and stakeholders will report on the state of health delivery in the district. These panelists will include Dr. William Miller from Adventist Health, Fort Bragg Police Chief Neil Cervenka, Lucretia Renteria from Mendocino Coast Clinics, and we have also invited someone from Sherwood Oaks, and we're trying to round up a dentist who could also speak on practices in dental. The presentation. In
addition, Ms. Wiley, Director Katzoff is searching an alternative health individual that can participate in our panel.
Thank you.
Yeah.
And you guys need to speak into the mic, I'm being told.
Okay, sorry.
And then the presentations will be followed by a round of questions and answers, and the event will be available to attend either in person or via Zoom, and it will be recorded so those who can't attend can view it after the fact. I wanted to report that I've been working with individuals to identify someone willing to contract with this district for Spanish translation services and for district documentation and notices to the public. More information on this will likely be brought forth at the board at their May meeting. I want to report that Carl Schurman, I hope I'm saying that right, from HCI, which is the California Department of Healthcare Access and Information, will be attending the May board meeting in person to explain the seismic retrofit requirements and to answer questions from the board and the public about the retrofitting timelines. And then lastly, I learned...
Let me just emphasize
Please.
that, although that would be a report, given this importance of the information that he's going to talk about, we're going to allow public questions comments from the public at that point, or questions from the public at that point. Yeah, thank you.
And then lastly, I learned recently, actually from Director Savage, of a California State Student Employment Opportunity Program offered to institutions like Mendocino College To place students in organizations, including nonprofits, the students earn comparable wages to others performing similar work in an organization, and the exact wage is set between the institution and the organization. The nonprofit. California pays 90% of the wages, and the organization pays 10% of the wages for such students. The students have to be from an underrepresented group, which includes first-generation college students, low-income students, students who are current or former foster youth, homeless students or those at risk of being homeless, students with disability, displaced workers, students with dependent children, formerly incarcerated students, undocumented students, and students meeting the requirements of Assembly Bill 540. And so we're looking into that as a possible source of some labor force and also some training for someone who might have that aptitude and qualifications. So I will be researching that and coming back to the board with more information. And that concludes my report for today. Thank you.
Okay, thank you. Any questions from the board? Okay, moving on. We're now at the consent calendar. There are 3 items on it. Is there anything that the board members would like to pull for discussion? Okay, hearing none. Before we move to before we move on that, public comment. Mr.
Chair.
McDonald.
Before we do public comment, may I make a statement on this?
You have the floor.
Okay, thank you. I believe we have here on the consent agenda the April 10th special meeting minutes.
Miss Alley,
Hey,
I'm
Marshall, do something
unable
with the
to
sound.
understand
Yeah.
what you're saying.
I can tell you, she is referencing 6B. 6B.
Yes.
6B, the minutes were not available at the time of this meeting today, so this should be tabled to the May
Yes.
meeting.
Oh, okay, that's 6B.
6B.
6B needs to be pulled.
So that wouldn't be a part of the consent calendar. And then just to note that the consent calendar includes a change for the May meeting to May 23rd instead of the regular May 30th.
And the reason for that is the Mendocino High School graduation is May 30th. And so our awesome tech crew is not available that evening.
We've been triple booked that day, so I can't be in 3 places at once, unfortunately.
What is the matter with you, Marshall? Okay. Okay, thank you. So without objection, then we're going to pull 6B because they were not available in time. So any comments from the public? I believe Mr. McDonald wanted to make a comment on 6A or 6C.
In the minutes, it would be nice if my name was written and spelled correctly. I think it's available many places, so maybe Ms. Alley could, I'm sure she'll figure it out eventually. And I would remind the chair specifically that one of the items in the February 29th minutes was heard incorrectly. One of the consent calendar items was heard without public comment. The other item after the back and forth was heard with public comment. But the first one, I don't want to guess right now. I should have brought my paper with me. I believe it was the
They were
A.
minutes. They were previous minutes.
Yeah, the February 29th minutes. That nails it. Thank you. And they need to be reconsidered at a future meeting. Thank you.
Thank you. Okay, with that, any comments from the board now? Board discussion over the consent calendar? Hearing none, is there a motion to approve? the
Okay,
consent
I
calendar?
would move to adopt the consent calendar with the item of the
6B.
minutes pulled.
6B pulled.
Yeah, correct.
Do we have a second?
I'll second.
Okay. Roll call, please.
Thank you,
Okay.
Chair. Secretary Susan Savage.
You're
Oh
calling
my
the
gosh,
roll?
I'm so sorry. That's not me.
No.
Secretary Savage, you go right ahead. I'm so used to doing the roll call. I apologize.
Okay. Susan Savage, yes. Paul Garza,
Yes.
Paul Katza,
Yes.
Sarah Spring, absent.
Okay.
So the consent calendar is adopted.
Is adopted. Okay. Let's move on to Ms. Garrity, I believe is online, for the compliance, seismic compliance team progress report and an update on community meetings, which, okay. Ms. Garrity.
Good evening. Thanks for having me again. Appreciate the opportunity. We submitted from the seismic compliant team a report for the board meeting this evening. And rather than read that word for word, I'll trust that you all had time to take that in. I will give an update to that regarding information sharing. We are waiting to connect with or hear back from legal counsel on an informational mailer to send to registered voters within the district. And at the time of that, we will also produce social media graphics to post to the district's Facebook page and working on corresponding digital outreach. The intent of the team is to also make a presentation next month at the May meeting, and I think that's all. Unless you have any questions.
Board members? Okay, I believe this is a receive and file information only at this point. Okay, thank you so much. With that, we have a very now important item to consider. Let me call on Mr. Hurst for the consideration and approval of the Measure C Committee Recommended Fund Cash Receipts and Disbursement Record. Mr. Hurst.
I think the first item is the often revised record of receipts and expenses for Measure C. And Wayne has done a very good job of taking all those numbers based on the reports that I've been providing to you the last several months and putting them into a fiscal year presentation as opposed to my running chronologically through a 12-month calendar. And those numbers are all in agreement. The amounts of money that have been authorized, allocated is the term we use. That doesn't mean they've been spent, but that means that they've been allocated from the Measure C receipts. And so the first item on your agenda, 7B, then you should approve that. And then we finally have established the history from 2019 through 2024 as to those account balances, receipts, and expenditures, or again, allocations. The second item on the agenda is what took place at the meeting that the Measure C committee had this week on the 23rd, I think, to review new requests that Adventist Health is making to you for additional expenditures. I'd like to make a few side comments, if I might, on this whole process. You're the third board that has been dealing with Measure C. The first board was a piece of cake because they were operating the district.
I'm sorry,
They were
The
operating.
first board,
okay.
2019, that whole process was a piece of cake because They were operating the hospital. We could identify projects. We were working with the staff. It was all really good. We set our priorities. And the Measure C committee and the hospital district was working from, here's what we want to do, what has been done or what needs to be done. And that was very effective. The second board that followed the passage of Measure C messed everything up. And you, as the third board, have got to straighten it out. And so my comments tonight are going to be largely along those lines. Let's get things correct. Wayne's presentation has been the first concise effort to accurately identify that. Measure C committee provided that to you, but I think Wayne did a better job. Let me back up. I was the chairman, co-chairman of the Measure C committee. So I've been involved with this process for 5 years. And I have no recollection of it ever being discussed with the Measure C committee that 100% of the Measure C money should be used for deferred maintenance. But that's where we are now. And that's what you're doing. $1.5 million is the typical annual parcel tax receipts. And that's all going in to fund your $2 million annual commitment on the lease. $1 million in January, $1 million in July. As the chairman of that committee and a person who was very involved in campaigning on the issues, the taxpayers of this community had a lot more on their minds than deferred maintenance. In fact, with the previous two boards, the first board when the lease was negotiated and the second board, we often talked in the Measure C committee about things that we could be doing to enhance the healthcare services in our community beyond deferred maintenance. So, when I voted and when I campaigned, I have to tell you, deferred maintenance was not at the top of my list. There were lots of other things. But the reality is, as Adventist Health has presented to you, the deferred maintenance is way behind. And the Measure C committee looked on the 23rd at $5 million of deferred maintenance needs to continue to provide healthcare services to our community. I understand that real need is about $7 million, but that's what we were looking at on the 23rd from the current project proposals for going forward with Measure C committee funds. I think you as a district have a responsibility, and I'm talking as a private citizen who has a business and has leases. You as the leaseor of the hospital district have a responsibility to your taxpayers to take care of the deferred maintenance of this hospital's needs, even if it's beyond $2 million. Where's that money going to come from? You currently have on deposit $13 million, according to the presentation that you made today. I think you got to step back and you've got to work with Measure C, and I mean with Adventist Health, and say, what are the priorities that we've got to take care of to ensure that we're providing quality healthcare services to this community? That's what Measure C was about. That's what you're about. As a property owner, I get a lease payment. I have to put money back into that property, sometimes more than I receive in leases, to make sure that my business and my leaser can accurately function. On the 23rd, the Measure C committee looked at the $5 million that had been identified by Adventist Health as immediate needs. Three of those were given priorities. And the Measure C committee approved $2.25 million, $2,250,810 of those items. And I would ask tonight that you move those forward and that we get those done. The difficulty that you have is that the perception has been that your only obligation was $2 million a year, and that 75% of that would come from Measure C money, $1.5 million. So we look at $1.5 million every year coming from parcel tax, i.e. Measure C, and we have $500,000 plus or minus coming from your general funds. I think you got to go beyond that. I think we're in a situation that needs some really serious looking at the facility needs. And the Measure C committee has no, we're only three people, but we have no feeling that there's a limit on whatever we have in Measure C ought to be going to take care of these needs. The Measure C committee's oversight responsibility is to see that the $1.5 million that comes in every year is spent within those criteria. There are 8 criteria. We always approached it probably immaturely, that we could take and put this money here and this money here and this money here and spread it around over those 8 criteria. That's not possible anymore. The needs are too great to keep this facility functional and operational and providing the care that our community deserves. So we're proposing, we've approved $2.5 million again out of the $3 million unallocated funds. You know, that means there's not a whole lot left, but there will be in this fiscal year, but the new fiscal year is fast approaching, and there'll be additional monies coming in, and the Measure C committee will be very willing to look at moving those to deferred maintenance until we get this thing taken care of. So, thank you.
Okay, thank you. Questions from the board? Well, apparently they're, yeah, okay, you.
And I'm trying to decide.
I
if this
didn't
is
mean
a
to leave you
ignorant
dumbfounded.
Sorry.
I've been thinking a lot about this, folks, and
Yeah, no.
and you know I've got 18 months left on Measure C committee, and I'd like to get this thing worked out.
Yeah, agree. I was just wondering, and I'm trying to sort of do a mental inventory of all the things I've seen go by in terms of, is there any relationship between the list of things that need to be done, and I'm not sure if this is a Peter question, that this 2.5 million would be addressing, and anything that might happen as part of the seismic retrofit? Is there any relationship between those things
That's a good
at all?
question, and I don't know the answer to that. Peter would. You're absolutely correct. I doubt it, but I don't know because I don't have even a clue what the seismic retrofit is going to involve. All I am seeing is here are immediate needs that we need to make this hospital work, and Adventist Health has a responsibility to do that. You, as the district board, spending the taxpayers' money, has a responsibility to do that
Got it.
because the taxpayers are paying for it.
Hey, Jim,
Yeah, Paul?
isn't Adventist a business, a for-profit business?
Is Adventist Health a for-profit business?
Yeah, it used to be that all hospitals were nonprofit.
I don't think that. I think they're all nonprofits. They're nonprofits.
They're not a nonprofit, right? You are.
I don't know. Yeah.
Just, one of the things that I'm concerned about, just, brainstorming, just talking off the top, responding to you, is that the community has bigger issues, like you said. They perceive us as responsible for 16,000 people up and down the coast.
Right.
And they don't perceive us as a funding source for bringing the hospital up to snuff. Now, that's it's not what I believe, right? But there's a perception out there that this board has to deal with. We have to spend some of the money on other things other than the hospital. How do you get community health happening if you're not willing to spend any money in the community on other kinds of things than hospital repair and maintenance? How do we get the community to appreciate the large role that this group has if we are only focused on spending money on something more narrow? And we have to build our own credibility. This community needs to believe that their healthcare district board is a big thinker, not a narrow thinker. We don't have that credibility yet. We need to do it. We need to earn it, and we have to do it through the people that we finance, the people that we fund, the staff that we may have, that goes out into the community in some way, some program, some old way of doing things, where actual people went out and did things instead of going on their computers and communicating. So I'm sort of frustrated being an old timer, being somebody who was around when people actually said, hey, how do we solve that problem? And then created a program and hired the people and got something happening in the community. Whatever that community was, whether it was a barrio in East Harlem where I worked, or it was a place in Mendocino, building a Friendship Park or whatever. We have to do some community work as well as hospital work. And so, like, when you started your little monologue, you talked about what you voted for, right? That you voted for something much broader. And I say we have to find a balance, a really good balance between the maintenance and the upkeep, the deferred maintenance and upkeep of the hospital, and the balance of community work. So what I'm saying is I don't disagree with you completely, but I just wanted to broaden the scope of what you, of how you, because you started big and you ended narrow. And I wanted to, like, I was hoping you would start big and stay big, because we need big ideas. We don't need small ideas. We don't need tired ideas. We don't need ideas that everybody understands. We need something more than that. So that's what I was trying to do in my monologue, which was a response to yours. And I don't want the hospitalists are wonderful people who are trying to do something phenomenal and bring this hospital back to being the beautiful place that it was in the past and probably is still. I don't want them to feel that I'm opposed to spending money on deferred maintenance, but I just want a little bit more wiggle room to do the work that we have to do. So you can respond to that if you like.
Paul, I agree with you completely.
That's enough, say no more.
We've been working on these community issues for the last 45 years together most of the time. But I have to ask you this question. Tell me one thing, one non-deferred maintenance project that this district has initiated and worked on in the last 3 boards.
I can't.
There are none.
But I have some ideas, and I will present them shortly. Not at
Yes,
this
Paul,
meeting.
and they should be. And that's what the Measure C committee was discussing and talking about for the last 5 years. And that's why I was saying to you that we never talked about 100%. If you put 75% of Measure C committee into the $2 million obligation that you have, that's all the money. I'm saying to you, there's $13 million that you have in deposit. And special district COVID relief provided $5 million of that. I'm the chairman of the Harbor District. I didn't think we deserved a penny of special district COVID allocation. But we applied because everybody was applying. We got $1.2 million. What are we doing with that $1.2 million? We are improving the Harbor District. We are putting in ice machines. We are working on fuel docks. We are using that money to initiate and to do new things to make our fishing community viable. You've got to do the same thing.
Amen.
Sorry.
Sit down now. You said it perfectly.
Thank you, Mr. Hurst.
You're welcome.
Regrettably, we're going to have to move to closed session for a few minutes. Please remain because we need to go to public comment.
Yes.
And I'll entertain that as soon as we get back.
I'm here.
I apologize for this interruption, but it is where we are, so I need to dismiss the group.
Oh, yeah, no, it's
We will come
7:15,
back.
I understand.
But please stay here.
I will
Sorry.
say, I hadn't expected to take.
I wish I could offer you
Can
a
we
cup of
ask
coffee
how
or-
long the
or a-
closed
or a
session will
stiff
be?
drink
How long
or
is the
something.
closed session
They're
going to be?
asking for how long the closed session will be.
Maybe 15 minutes.
I hope not more than 15 minutes, but we need to do this right now, so.
Yes.
Again, I
Chair,
apologize.
before you go actually into closed session, you do need to ensure that you are taking public comment on the closed session.
Okay, all right, oh, great. All right, sorry, I'm
It's
being
okay, it's
corrected.
okay.
Sorry, I'm corrected. We're open for public comment on the public comment on the closed session. Thank you. Okay, Mr. McDonald?
Thank you for recognizing that, and thanks to Norma.
My mistake, sorry.
No, I'm given the transfer of things, yeah. This is more for the public. If you want to have some understanding of what issue is involved in the closed session without getting the details that a board would talk about in closed, I would advise you to read the warrant list attached to this agenda and read the invoices attached to the individual items carefully, and that will give you a pretty big clue flying around that you can catch as to at least the general issue that's at hand here, which sometimes closed sessions can be frustrating for the public because you don't really have any idea what's going on. We're not going to get, well, we might get in the report out something, but just that's what you could do while you're waiting, is read the warrant list really carefully. Thank you.
Okay, thank you. Mr. Ramos, did you have a comment? Okay. Again, I apologize. This is a great discussion between Director Katzoff and Mr. Hurst. So I want to get to be able to continue that. I think it's a very important one as well.
It's like
For your patience. Regrettably, there was a matter that we had to deal with that has significant importance. At this point, I can tell you that we took no reportable action, and any future updates we will provide when appropriate. So with that, let's go back to our discussion of Measure C, and where's Mr., oh, there you are. Okay, please, if you could please come back to the podium. Director Savage, do you have any questions for Mr. Hurst?
Not.
Not at this point. Okay, given that, then I'm going to ask for a public comment. Dr. Miller? Okay, together, whatever. That's fine, great, thank you.
Thank you. Peter, do you mind joining us as well?
Oh, the triumvirate.
Well, this was important, that you hear the clinical piece, that you hear the facility piece, and that you hear, I'm going to represent the community piece. First of all, I so appreciate the education, Mr. Hurst, that you bring forward, and the history and the perspective of what Measure C was designed to do. I also appreciate the fact that your passion resonates for what's best for this community. This structure that we are in belongs to the people of the Mendocino coast. I want to thank the district for serving as the facilitator of the bricks and mortar that allows us to provide care. For the clinicians that do that with impeccable quality and safety at the heart of every patient. When you're a patient in this hospital or somebody that you love, you want to make sure that they are in the safest environment for that care. Measure C and the district has been receiving
I don't know who that was, I'm sorry.
Oh, it's
Toby, could you mute yourself? Thank you.
Measure C in the district has been receiving a list and at times seeing images of a facility that requires substantial improvement in order to deliver that quality, safe care. We have nearly 7.6 million in active, committed, and closed committed projects for this building just to meet minimal improvements. Those improvements are required by the Joint Commission, which is the accreditation body that keeps the doors open to the hospital.
Yeah, Ms. Leitz, you might mention that that is a federal agency, and a failure to comply with their standards would close the hospital.
That is very true. It is a federal agency. It is a neutral agency, not one that we contract with. So when Joint Commission is here, and you will remember that before Adventist Health came into this community, this hospital was in immediate jeopardy. Meaning if issues were not resolved, the doors of this facility would close to the care of the community. This year alone, there is $4.8 million in projects that need to be done in order to provide safe care in this facility. Now, we provide exceptional safe care from the clinicians, but you've got to have systems in place in a facility in order to do that. We have had to commit $2.225 million already this year in order to be compliant for some of these essential things that are needed. Just to achieve some of those minimal items, again, we've got a commitment of $4.8 million in updating just to be that safe haven to deliver care for our patients. So we're here tonight to explain why that matters so much, that Adventist Health would receive at least a 2.3 million, or let me rephrase, that's 2.255 million, in order to do some of these essential things, and Dr. Miller and Peter will explain what those items are.
Okay, thank you.
Thank you.
Well, thank you for giving us some time to speak with you. And as always, I just really appreciate the tough job that you all have sitting on this district board. We are on the agenda under Prop C, but really, as was pointed out earlier, this is really a broader matter and predated the affiliation with Adventist Health. I'm very glad to see Wayne Allen, my dear friend, back in the saddle. Wayne and I worked together to craft the actual initial request for a proposal when we were starting to talk about affiliating with a hospital system. And Wayne and I, together with other members of the community and the district board at the time, reviewed the proposals, and ultimately, as you all know, we chose Adventist Health. At that time, when we were looking at the need to affiliate with a hospital system, we already were aware of all of these projects that needed to be done. The deferred maintenance started being deferred way before the affiliation. And one of the hopes was that by affiliating, we might be able to get some of these things accomplished. Not because we were hoping that Adventist Health would pay for them, but we were hoping that at the time that by the district having somebody else manage the hospital and pay the salaries of nurses, etc., that would then free up the district to focus on some of this deferred maintenance. The deferred maintenance that we're talking about does have very real potential impact on patient care safety. Now, I want to reassure this district board and the community who's listening that I believe that we are a safe hospital. However, we still have to address these issues. And a number of these issues have been pointed out, as Ms. Leach mentioned, on previous Joint Commission surveys, because they look at the facility, and that's a big chunk of the survey is you have an engineer walking around the building, and they're up on the roof, they're looking under the floorboards, etc. So I would just like to talk a little bit about some of the projects. So for example, the roof leaks. Roof leaking water creates potential for mold. That's an infection prevention issue. So that's a patient safety matter. We, as you know, Adventist Health spent a lot of money replacing the flooring, replaced all that red carpeting, and also replaced the flooring in the ER and most recently in the ICU and some other areas. And one might say, well, that's just cosmetic. But actually, all of those flooring projects were ones that we've been cited on for infection prevention. The carpets were not meeting the expectations in terms of infection prevention and had to go. And the flooring in the ICU and ER was so damaged that the housekeeping was unable to do it and meet the standard of cleanliness. And so those are two projects that we're talking about on the list. The HVAC, or air handling system for the operating rooms, that is also a infection prevention matter, and we just don't have any choice about it. Another thing is the electronic transfer switches, which there are 4, and these, of course, are these automatic things that are supposed to flip over when the electricity goes out. Fortunately, it never goes out here on the coast, but in that rare event that it actually would go out, they automatically flip over, and then our own electric generators are supposed to kick in. And there's 4 of these, and one of them has been recently replaced, but another one is very old, and during the last electrical storm actually malfunctioned and had to be manually flipped over. So that was a big issue. And these are just some of the highlights. And so when we look at the hospital and we look at our community's investment over the decades in this hospital, we need to keep it up. We need to do the upkeep, and I appreciate Mr. Katz's vision. I think it is the right vision for the community to try to focus on health and well-being and not just taking care of disease. But I think that also at the same time we have to somehow come up with the money to do these repairs that are way overdue.
Thank you, Dr. Miller. So a few of those projects that Dr. Miller mentioned, I won't repeat those. A couple that are Joint Commission findings that are ongoing as of today that must be completed are some roll-down fire doors. Those were cited by the Joint Commission during our last survey, and we're anticipating a new survey coming soon. So we're safe now, but there is a sighting on that. And then another project that is very important is the vacuum pumps. Our vacuum pump system is rather aged. It's functioning right now, but it's going to be something that we need to look at in the future. So anyway, any other questions?
So, board members, thank you for hearing us today. What you're hearing is a sense of urgency in order to maintain the safety of this building. And I'm talking about just the facility. Never in a million years does anybody have to doubt the safety of the care that they would receive in this hospital. However, if we don't have systems that work electronically, and if we have systems that are compromised, one which I think began long before Adventist Health ever got to town, Peter.
So the main hospital automatic transfer switch started many years ago by the district, and when Adventist acquired affiliated, we continued on with that project. The project now is near completion, but it took many more dollars than was originally anticipated. And it was one of those projects that was not started by Adventist, so we had very little control over how it grew. And then another project that was already underway was the OR HVAC project. That was already underway, and we continued and completed that. So a couple of wins in our corner as a team. We were able to get the automatic transfer switch on the main hospitals changed out and brought up to nearly completed and up to code. And we were able to, get the OR HVAC system up and running. And that has made our OR one of the safest in the county, I believe. It's got a brand new HVAC system. So.
I mentioned the medical error.
Oh, thank you, doctor, for reminding me. So. Early on, we discovered that the medical air system that was existing 4 years ago now, was actually just air compressors from Granger. They were not medical quality air compressors that were providing the medical air to the hospital, which immediately was resolved. We started an immediate project to turn those off and get the hospital on high pressure cylinders, on bottled air, to ensure that we had safe air for our patients. And this is all going on during COVID, right? So we've got a medical air system now that's safe and reliable. It has medical grade compressors and all of the electronics that are required to meet the standards of medical air. Medical air is considered a drug. So anyway, it's very important that we have the right medical air. So.
Thank you, Peter. In summary, and then we look forward to your questions. In summary, you've heard the need, and the need is on a facility that's 52 years old. In the past, we have brought forward to the district board photos where you see the condition of some of this equipment that's on our roof. Some of the equipment that's not in major space, but behind walls, but it's critical equipment for life-saving care. Once again, today, our request is that a consideration of a $2.255 million transfer happen to Adventist Health for the district's building in order for us to provide the continued care this community deserves. And once again, this year alone, there is $4.8 million in projects that does need to happen in this aging building. Thank you.
Okay, thank you. Thank you. Okay, we are still at public comment. Is there?
We have Anna.
We do have public comment here online, Chair.
Anyone online?
Yeah, Anna.
Yes, we have Anna online.
Okay.
Who'd like to
Hello. I'm pretty new at this. I've been studying Measure C, and I also understand there's a proposal. I'm on two tablets here. I hope you're not getting feedback. And I understand there's a proposal in the works for possibly another bond measure for the seismic retrofits. One of the things I would like to see in these kind of asks and these kind of presentations is actual slides with actual numbers, and especially regarding replacing existing equipment that is supposed to be depreciated over time. Hence providing deduction, and hence providing a combination for funding in the future. And so it would be really nice to see the actual numbers and the original cost, the depreciation over time, the accounting method used, and the tax deductions, which are supposed to be put into a reserve to replace the equipment instead of just saying, hey, this equipment's old and we need more money. Because that's very general. And not everybody is in business or finance or has an MBA, but some people do, and certainly you people should know. And I believe if the doctor stands up and makes a presentation, there should be visual aids and there should be numbers. And I hope we can see that in the future so that we can all understand the ask and the from where the money is being requested and why. Thank you very much.
Okay. Thank you. And I believe we have Mr. Childs.
Yes, hi, thank you. I'm a total outsider on this, and everything that the Measure C that Jim said and that the hospital staff said all sounds wonderful. I would just like to offer this as an outside thought. Anytime any huge expenditure being proposed by the people that will benefit from it, it's always wise for a second opinion to be offered on it. And while everything they say sounds absolutely right on, wonderful, necessary, important, I just want to offer this to the board that if there is getting a second opinion, an outside source that can go through all the numbers, all the projects, and say, wait a minute, this one probably isn't necessary at this point, or you know what, I think you've overestimated the cost on this, just so that you have a second alternative look at this to make sure that everything that you're authorizing to be spent, has been double checked and looked at from an outside expertise consulting firm. It might cost $100,000, but who knows? Maybe it'll save more than $100,000. I have no idea what the cost would be for an outside consultant firm to just double check and make sure everything makes sense. So that's my primary concern. The second one is I have a personal concern with the seismic retrofitting. And I don't know if this is the right time to offer that to your consideration, but it just seemed it's a huge subject. And I think really it's so big that I just wonder if it's really necessary to go down this road and keep spending money when the odds of the benefit of an earthquake, the small margin of additional earthquake benefit that it will provide for the huge amount of money is so small. And I would just like to offer this because a geologist told me this. He said the odds of an earthquake in Northern California are very, very, very small. He said, and so you should get an outside geologist to confirm this, because this is what I heard. He said earthquakes of the magnitude that we've experienced in 1906 occur once every 300 years. The 1906 happened 100 years ago. The odds of something that large happening here in Northern California are very, very small for the next couple of hundred years. So I know the construction industry is always trying to find ways to, keep their employees busy. But I think this seismic thing should be really thoroughly investigated to see if it's cost effective, how much benefit you get, and whether it's really worth it. And specifically, is the state really going to close you down if you don't meet their standards? Not likely, I don't think. So anyway, thanks for allowing me to throw in my 2 cents worth on those two subjects. Thank you.
Okay, well, thank you for your comments, and I would encourage you to attend our next month's meeting where we're going to hear from the director of HCI on that very topic about what the state is going to require us to do. So any other comments from the public at this point? Okay, with that, let's go back to board discussion now. Director Katzit?
What?
Director Savage? Well, we potentially have a motion to approve the Measure C recommended items from 41724. And then we have an additional, once we get done that, we have an additional item. Excuse me. The fund cash disbursements receipt of April 30th, 2024, that's in your package, we need to approve or not approve. I mean, we need to. And then we have the second, so we're at item 7B, and then we need to move on to, once we deliberate or on that, we need to move on to 7C. So the first is just this, yeah.
Okay, well, I'm looking for which page that you are on right now, but I would.
Can you help us with this,
You
Ms.
bet.
Wiley? Because we've
We
got a
are-
huge.
We are on item 7B, and
Well, but I'm looking for which page in 7B, and it's.
so it's the second page of your agenda, or, so I'm sorry, it's page 3 or 4 of your agenda in the middle. And the Measure C committee has recommended to allow Adventists to move $2,258,810 from their restricted account.
Yes. Okay, I would like to so move that we authorize that, and I'd like to speak to that in a second, if there's a second.
I'll second that motion.
Okay, I'm really feeling that we have to be in a place, because I think our community demands it, that we have to be able to chew gum and walk at the same time, that we have to keep our obligation to the facility itself, but I don't see why we would not also be able to address the broader needs of wellness, et cetera, in the community. And I think we had an appeal from Mr. Hurst that we need to get to it, that we need to come up with some proposals for how specifically do we address beyond just the facility itself. We need to get to it. But for me, anyway, protecting and continuing this facility is critical. And so I heard $7.6 million in improvements, and that this at least is a start toward that. And I would strongly encourage us to transfer that money and then get on with the conversation about how we take care of the rest of it and address some broader community concerns.
Okay, Director Katzit.
As chairman of the planning committee of the board, I will promise you that within 30 days,
Yay.
you will have a few proposals in front of you to vote on or to think on, and then maybe deny.
Or encourage.
Well, that's
Well,
that's optimistic assessment, but okay.
We don't want to
Sure.
have everybody doing too much work.
Can I just make a slight correction? 7B is to,
That's what I thought, it's just a cash
it's,
disbursement, is
it's
it?
accepting the balance, the Measure C going forward balance. And then 7C is moving that 2.258.
Okay, Norma, we're in one of these Robert's rules kind of things. I think we stepped out of order. Is there a simple way to correct that?
Can you hear me?
Yes.
There we go. I thought I'd put an earpiece in and that would help with the sound, but I don't think it did. Kathy is right. We're on 7B. The recommended action is approve the Measure C Committee recommended fund cash receipts and disbursements record and authorize the transfer of district funds. I do think that some of the testimony, the public comment that was made has led in kind of combined B and C together, but we are on B. It's my understanding from what I heard that that was the motion, so please correct me.
I believe actually the motion addressed item C.
Right.
So if let me do this then. The chair will now entertain a motion on for 7B. Are you willing to make that motion?
If you need me to withdraw my previous motion and amend it, or what do you?
No, let's just keep that to a side and let's go on to 7B. Do you have a motion on 7B?
Well, I'm looking at 5B, and so I'm totally confused.
No, you're right now. You're in the. I'm sorry, you're in the minutes. Okay. Then the chair will then move that we approval of item 7B.
I'll second that.
Okay. Any discussion? Public comment? Okay, roll call vote?
Okay, just so that I know what I'm voting on.
Mm-hmm.
So the motion that I made that is now is to authorize, and that's item what, where?
So you addressed 7C, and that is authorizing the movement of $2.258 million.
Correct.
And B is to authorize,
I'm trying to find it too. I had it tabbed, I thought, but I lost my tab.
Okay, this is what I was talking about, Kathy. This can't go on.
We need pages, numbers.
Well, we need a different system, and we'll figure it out. Okay, so 7B is to authorize the movement of the money as suggested by Mr. Hurst.
that's
correct?
no, that is to accept the balance that was given as a recommendation by Measure C. It
Basically, this.
memorializes the correct balance of
Got
the
it.
Measure C
Okay,
account,
Okay. All right, so we would be accepting the report from the Measure C committee?
saying this is the correct balance.
Correct. Okay, I would so move.
Okay.
How's that?
And we have a second from Director Katzoff?
Yes.
Okay, and no public comment. Roll call, please.
Okay. Sarah Spring is absent. Paul Garza?
Yes?
Paul Katza?
Yes.
Susan Savage, yes.
Okay, thank you.
So,
Now, let's move on to the motion that you made on 7C.
okay, which was to authorize
The
the
improvement.
transfer of the money to Adventist Health as recommended by the Measure C committee, correct?
Correct.
Okay.
So I'll second that motion, if that's a
Second.
motion.
Okay.
We'll assume it's a motion.
Yes, it is.
Okay, so,
Is there more public discussion on that
any
one?
public comment? Okay, hearing none, roll call?
Okay, Paul Garza,
Yes?
Paul Katza.
Yes.
Susan Savage, yes. Sarah Spring, absent. It's approved.
Okay, thank you. Now, let's go on to, receive the listing of bank balances and the approval of the warrant list. Mr. Allen, would you please present that?
Thank you, Mr. Chair. We'll start with the bank balances. This is an abbreviated financial report that I developed only because the information is still not available and accurate to prepare a full-fledged finance report. You'll see here in a couple more documents what that might look like, but we got 2 pages of, first of all, the cash balances, and they total almost 13 million, and based upon the April, what was it, a couple of weeks ago, we had an investment policy, and we agreed to transfer some money out of no yield and no FDIC, and I'm showing you there that transfer has been made where everything went into the Bank of America and it came out of California Commerce Bank and Tri-County Bank. So that authorization did happen, and wire transfers and so forth. They're not in that March 31, 24 balance. We did that in April, so they'll be in the April balance. Another part of the cash report I want to make, I heard Mr. Chair make a few comments about it, I think. I've been working on the last couple weeks, making phone calls, 2 or 3 phone calls per week to the Rate Review Division of the state of California. The prior district board sent an IGT payment, intergovernmental transfer payment, to the state in air. The hospital or the district was not qualified to do that, to receive those funds as matching. So that $1,095,350 has been on deposit with the state of California. And I know a couple people down there, and they have agreed that they're going to probably sign off on it tomorrow on Friday, that it's been approved to be refunded to the district. So that's good news. We'll be bringing in a little over $1 million of our cash that should not have been invested that way. I made a comment to them. I'm expecting interest income at 5% per year, and so they kind of laughed at me a little bit, and I don't think I'll get that, but at least I put it out on the table. So we'll be getting hopefully the check will be coming the last week of April. The other comment I would have about this cash balance, this board approved 2 weeks ago bank resolutions and bank and check signers 2 weeks ago. And I've been working hard, Kathy's been working hard, and Paul's been working hard with us, and we still only have one of the banks, and it's really not a bank, but it's Leif. Leif has got a green light that we can do transactions with it. Bank of America and California Commerce and Tri-Counties, I can't do business with them yet because they have not adopted all the resolutions and crossed all our T's, and I think banks have more rules and regulations than hospitals, but we'll work through that, and I think we're getting near the end on most of it, but it's been very frustrating and very time consuming. It's something that you expect you can do in 2 or 3 days. Well, it's been 2 weeks and it's not done. Then let's move to Oh, okay, any particular comments on the cash balances and reason?
Board?
Okay, let's move to the warrant
Second,
list.
Wayne.
There's
Hold it, hold it.
good listing of, warrants that,
Mr.
okay, we got it.
Talk really loud.
Okay,
Into
you,
the mic.
yeah. You indicated that you explained the bank balances, so we want to check and see if we have any questions from board members first.
Well, I had questions about these pages, and I'm not sure if we're going to talk about this
No.
or not.
Yeah, he will be
Okay,
talking.
Okay.
good, thank you.
Okay, Director Katza?
No, I'm good.
Okay, okay.
I'm still searching for.
Public comment, Mr. Ramos.
I just had a question. I thought we just moved a bunch of the monies into California Commerce Bank, and now we're moving them out. I think Wayne alluded to it. Thank you, Wayne, but I'd like to better understanding why that actually happened. And then, I know, Wayne, you're less than a month in. I'd also like a ETA for balance sheet and P&L. It's been a long time since we've seen those. Thank
Yeah,
you.
we're going to get to that. Thank you, Mr. Ramos. I think the answer to that is fairly simple. We are actually in violation of state law with the money in those accounts. So we now are moving to be in compliance, and we're doing that as quickly as possible. So, Mr. Allen, you want to go ahead now and talk about the warrant list?
Well, hang on just a
Okay,
second.
go ahead.
If I could make a comment, because I don't know, was that clear to you what that meant, or would you? Okay.
Okay,
Yeah.
let's finish the second half of this section, which is the warrants and the supporting invoices accompany that.
Mr. Allen, hold on, please. I believe Director Savage was asking for you to
Well, no, I wasn't
explain.
asking for it, and if nobody else is gonna say it, I just think it's helpful for people to understand that we were at risk on multiple fronts with where the money was, and that it needed to be transferred to be fully protected, because the state law requires that. So it required funds that were too much money in certain accounts to be moved to others to make sure that it's all insured and protected, since it's taxpayer dollars. So that was why those transfers were needed, and were needed as quickly as possible, so that the district wasn't liable for knowingly leaving funds unprotected. Is that better?
Go ahead, stand up, please. And that way we make sure we get it in the everybody can hear it.
I just had a question. I thought it was the California Special Districts Association that recommended those accounts, and that they were consulting with you on that? Is that correct, and yet their consultation was incorrect?
That's correct.
Okay, thank you.
Yeah, that's correct. Okay, I'm sorry, Mr. Allen, please continue.
Okay, moving on to the warrants, this has been prepared with the listing of vendors and amounts and the invoice dates. So some of these are quite outdated and stale, and I don't know what caused that, but hopefully we can do a better job of paying our invoices timely. So, and there's detail behind in the list totals. You can see that the list totals $72,537.39. So primarily it's a lot of it. I think I was picking up on what Malcolm was trying to insinuate. A lot of it is RGS and props and measures, and so and then the rest of it pretty much is legal people. So that's up for board approval, along with the bank account. And then this last 3 pages that you got is not part of the motion. I merely wanted to present to you tonight.
Mr. Allen, before you go forward, let's do the warrant list.
Okay.
Okay, so the board members have any questions about the warrant list?
No.
Okay,
Well,
Director
the
Savage,
question is,
please go through me.
Well, I just raised my hand.
Okay.
So, am I understanding correctly that with these warrants being paid, as far as we know, that all of our accounts that have invoices in will be current then. Is that correct? As far as we know.
Norma, I can't hear that.
Yeah, we can't hear. Is your microphone on, Secretary Savage?
I'm hoping.
She's asking, if the warrant list is approved in full, does that mean that all the vendors are up to date in getting paid?
Thank you.
Are they?
So to answer,
Yes, well, as far as I know, all of the invoices that have not been paid does bring it up to date, but I'm still get surprises every once in a while. So, so yes, to your question, I think it brings it up to date.
Okay, thank you.
Okay, thank you. Okay, any public comment?
Mr. Chair,
Okay.
why don't we go ahead and do a motion on that?
Yeah,
Then after that, I'll present my supplemental plan.
That's exactly where we're headed right now. So,
Okay.
okay. So now, okay, do we have a motion to approve the warrant list?
I'll move.
Shoes? You have a second?
Yeah.
Second, the Director Kassab, seconds. Okay, again, we have to go to public comment. Seeing none, roll call vote, please.
Okay. Okay, Paul Katzif.
Aye. Yes.
Susan Savage, yes. Sarah Spring, absent. Paul Garza?
Yes.
Okay.
Okay, Mr. Allen, now, thank you. I apologize for the.
Okay, I
interruption.
wanted to present this 3-page document to you tonight. It's something that hopefully, but I don't think it may be achieved, will be implemented for the month of April, but I can't do it unless I have accurate information. And more than likely, it'll be put in place in May. But the first page, page 1 of 3, is a income statement, profit and loss statement, and all it does on a cash basis is take a look at the receipts that are coming in the current month. I headed it with May, the actual receipts coming in, and then we should have a budget for that, which we don't have at the moment. But then the 11 months year to date on our fiscal year. So it tracks the current month that's being presented to the board along with the year to date history. It's a document that's used throughout the industry and, well, not the health industry, the whole industry of whatever you're in. So, and then in the expenses, the cash paid out is exactly that. You take and group it into a certain headings. I've come up with these headings. They're not fixed in cement at the moment. If we work with this a little bit, and we want to add another XYZ line item, we can add it if you want more detail. And at the moment, items A and B on salaries and payroll taxes, we don't have that, but that's typical for a business, and we could probably delete that at the moment, and then if we ever do have a salary situation, we bring it in at that point. And then you start with beginning cash and deal with the pluses with receipts, minuses going out. And then at the bottom, I want to see if there's money being transferred out of this operating account into LAIF or LAIF. LAIF is going to be when I talked about it, it's primarily a checking account for us, but it's not being called that. But we can put money in there and take it out on a 1 day's notice. So that's the point of this first page. Just as when I populate it with real numbers, you'll get familiar with it, and it'll be very informative. Let's move to page 2, which is a balance sheet that deals with assets, liabilities, and whatever retained earnings or net investment is left over. And you can see I've just listed certain accounts on there and the current assets. You know, I put one just called XYZ, whatever we're gonna name some of these funds. And then the receivables will be booked for Measure C and the AH rent. And then we need to bring in, we are the owners of the hospital. We need to bring in the property, plant, and equipment and less the depreciation and that. And then all of the construction in progress that's going on. When you make these approvals, they're not done in 30 days and they're done over 3, 4, 6 months, and it'll be recorded on construction and progress. Liabilities are typical accounts payable, trade payables, deferred income. If you look down under liabilities and net position, deferred income, that's going to be a little bit of a red herring. It is a red herring at the moment. That's where we received COVID stimulus funds back in the days when of, I guess, primarily 20 or 21, 22. And those, no, a little before that. So those funds have to be accounted for and then subject to an audit. Subject to an audit. We received over $5 million in stimulus funds.
Oh my.
And the last CPA audit was done when I was there. It was ending in June 30 of 2020. June 30th. And the audit firm properly booked on their audit report that $5 million in deferred income. And they'll be coming around here hopefully soon and doing what's called a single audit. All they do is come in and look at that number and look at your documentation and did you spend it according to what the guidelines were? And if you had a little money left over, you're supposed to return it to the federal government. If you spent too much, that's your problem. They don't care about that. But that issue is going to be coming up. I've dealt with it in three other hospitals with their audits, and that's an interesting process. So I guess I'm looking forward to it. So it's a little bit of a crapshoot at the moment. Hopefully we can document and substantiate $5 million of expense that occurred. And if we don't, then we're going to have a payback. And I don't want to see that happening. But I'm calling it to your attention. It'll be on the balance sheet, and it won't be resolved until that audit is done, which it's probably 3 or 4 or 5 months away. It's probably not going to happen immediately. Another issue to worry about. And then on page 3 is a summary of when I can get Bank of America to release some money, which I don't have the authority to do yet. I'm going to start purchasing some treasury bills, and they're going to be recorded on there by the headings you see. And that's this report you're going to get every month. It'll be populated and it'll be real time, so to speak. I talked briefly about it it's in our investment policy. And I talked briefly about it a couple of weeks when you approved that. So these are 3 reports that are important, and there'll be more. You'll be familiar with them, and they'll tell a story of what's happening, and it's available to the public, and it's very transparent. There's no secrets, and so just for your information at this point in time,
Okay, Mr. Allen, we really look forward to this report next month. I think, you know, Mr. Ramos expressed some frustration, and I have expressed that on a few occasions as well. I'm really looking forward to this, so thank you for that. Board, have any questions? Director Savage?
At this point, do you feel that you will have access to all the information that you'll need to have this ready by our next meeting? Or are you anticipating there may be some hiccups in there that we're going to have to overcome to get the data? Or what do you need?
Well, I've been in communication with Sarah, the treasurer, and I'm led to believe that it's maybe toward the end of next week, the documentation will be completed. I have to see that, verify it, so it'll be a tight thing because the end of next week is May 2nd, and it really doesn't give much time to populate it for April. So we're getting there, hopefully, and so I'm 40% think it might happen, but 100% think it will happen in May, so.
Okay, Director Ketzer?
What I have found out, I guess the board needs to understand this. Every little task that I've been working on, I think every single one of them, some of them should be done in 30 minutes, some should be done in an hour and a half. Every one of them has taken 5 to 6 times longer than that. It is just so frustrating, and, I'll cope with it and deal with it. But it's, things move slowly because a lot of reasons for it.
Okay, thank you. Thank you. Okay. Dr. Miller?
Thank you for recognizing me, and also thank you, Mr. Allen. You never cease to amaze us how you're able to get through these piles and piles of documents and sort it out and put it into order for us. So thank you
William,
so much.
It's great to see you, William.
Thank you. But the reason I wanted to step up here is to comment about the COVID money. So that $5+ million, as you know, came just a few months after the transition of the hospital from the district to Adventist Health. And there's been a lot of back and forth discussion as to who really should have received that money, because that money, of course, was supposed to, the idea of that money was to help offset some of the additional expenses in terms of nursing, staffing, et cetera, that a hospital was going to have to deal with during the COVID pandemic. And so I'm a little concerned when I heard just now from Mr. Allen that there's a possibility that we might, as a community, have to pay some of that money back. And I know that the hospital absolutely spent a lot of extra money during the COVID pandemic, and I think that if that is a possibility and there are specific earmarked categories, then I think it would be advisable for the district and Adventist Health leadership to get together and look about maybe reimbursing some of those expenses so that we can get that money to stay in our community.
Okay.
Can I ask a question? When that money came in, it was very clear how it was supposed to be spent, because I got a bunch of that money for my business as well. So I had to be very careful about how I spent it, because there's a lot of things when you got a big bunch of cash in the bank and nobody's looking, you can spend it on all kinds of things. So my question is it's like, did that same set of rules apply to the hospital in terms of what you can spend this money on and what you can't? And while in the, in a contemporaneous approach, did you, at the time, spend the money according to the rules? I mean, if we didn't spend it, you spent it.
No,
So-
you still have the money, but
Well-
yes, the hospital felt that the money should have gone to the hospital. I believe, it's my understanding that that 5.3 or whatever it is million still is sitting in your bank account.
Okay, so why was it not transferred to the hospital? Do you have any idea why? Because now we have to account for the spending of it, which we had no.
At
Why
the time,
you mean the
This-
current board?
Yeah,
Yes.
I don't mean
well,
me.
at the time,
I mean-
there was some vigorous debate back and forth between the district board and senior leadership at Adventist Health, and we were advocating for that money to be moved over, and the decision was made by the district board not to do that. And
why?
Why?
Well,
I guess you'd have to ask them, but I heard things at the time like, well, they wanted to think about using that money for other projects, for community. There was a number of different things batted around, and we were arguing, no, that money is supposed to come to a hospital, because the money was applied for by the district as if it were a licensed hospital.
So,
and I'm concerned that that little piece right there might be enough for the feds to say, look, you shouldn't have got that money in the first place, you have to pay it all back.
That's right. So my question is, what's your theory or thought about the record keeping that you can provide us so we can give you the money?
We absolutely can demonstrate how much more we had to spend during COVID on personal protective equipment. Remember, you couldn't even buy a face mask online,
Right.
For a while there. People in the community were sewing
Right.
out of dinner napkins, making masks. So there was that additional expense. There were, and that qualified. There were expenses in terms of certain medications that qualified. There were also emergency preparation things that we had to do. We rented a tent in case we had overflow. We bought new ventilators. And then the last thing was in terms of the expense for travelers, because a lot of nursing staff nationally quit or moved away from their jobs into being travelers, and the price for a traveler tripled, and in some areas went up 5 times. And so all those additional expenses do qualify, and we absolutely can provide the data, and I think it will exceed that 5 million.
Mr. Ketso, I know this is really interesting, but I'd like to see us take a step forward in terms of movements.
Can I jump in here?
Let me finish, please. So what
Okay.
Assuming Mr. Allen has some additional bandwidth, and I'm not sure he does, he's going to have to tell us that. But I would like to get Mr. Allen together with hospital staff as soon as possible to see if we can work through this. Is that something you can do, Mr. Allen?
Yes, Dr. Miller explained the expenses very well, and they're documented in the records, and because I was there at that time. The other part that he didn't mention, in the formula, you can make a calculation for lost revenue, because the hospital was kind of bare during those first 3, 4, 6 months. And I'm aware of that calculation, and I think it'll be enough to where we can keep all the money that we didn't spend on expenses. So I'm not doomsday on this thing, but if there's a small sum we can't document, then we can't do it. It's like medical records. You got to document. So, but I think at least 90% of the way there, and hopefully 100%.
And then, so what I would ask is that I would direct you to work with hospital staff and bring back a proposal for next month. Is that possible?
Yes, yes.
Okay, okay. Okay, Mr. McDonald, entertain a comment from you.
I just want to clarify something that the COVID, I hold Dr. Miller in high esteem about all things, but I think he may have inadvertently misled us here. The COVID payments to the healthcare district arrived in April and early May, even before Adventist Health took on the management of the hospital slightly before the official affiliation date. I've seen the receipts for those payments. So it did not happen after affiliation or even after the management agreement from some point like May 8th onward, whenever the exact date in May was.
So what are the implications of that?
Through the chair, please.
I'm sorry. I'm sorry.
Okay, please answer if you can.
Much what Wayne has said is that there's the question that, well, COVID didn't really hit until mid-March of that year. Then the healthcare district received approximately $5.3 million, as Dr. Miller said, in I believe it was two payments. Wayne could correct me if I'm wrong, in April and very early May. So, but as Wayne said, it's complicated because the hospital itself was losing, the hospital run by the healthcare district was losing drastic amounts of revenue in those 2 months. The hospital under affiliation was losing drastic revenue afterwards, so there's two sides to it. I just want to clarify that the payments were made before affiliation, before Adventist Health was managing the hospital.
Okay, I appreciate that clarification. Mr. Ramos?
Thank you. I just want to say that that means the bank records we just saw, you now have an accounts payable of $5.3 million to federal government or to Adventist Health. I'd rather see it go locally, but I would also suggest check your records to see if any of that money was already spent on this process, because you do not want to give up additional funds, right? Maybe you've already spent $2 million on COVID somehow tied to that grant. Make sure to research that before you come to a total determination on how much money goes where.
I couldn't agree with you more.
Thank you.
I think all of us agree. And Mr. Allen, I apologize, but it's some heavy lifting there, but we'll look forward to being able to work through this in May. Thank you. That was a bit of a surprise. I apologize. That was unanticipated, but I think nonetheless it was a very important discussion that we had tonight, and we'll look forward to getting this resolved. With that in mind, let's move on to our policies, and I'd like to turn it over to Director Savage to take us through these series of policies.
Okay, if I can find them.
Okay, so.
Okay, so we have a number of policies that I believe have been posted that people have access to. Thank you. That were recommended by Mr. Allen, that we needed to continue the process of putting our house in order. And these are fiscally related policies that you have before you. I don't know if you want to take them one at a time. Is that or do you
We'll need to take them one at a time because they're on the agenda one at a time, and you're going to have to allow public comment one at a time.
Okay.
Okay.
Let me just
thank you.
let me just add that if you don't mind, Director Savage.
Well,
Go
usually you
ahead.
put a motion on the floor first and then you discuss it, but.
No,
if you
we
want-
have to ask questions, then we
Okay.
go to public comment, and then
Got
we
it.
can come back.
Got it. Okay, go.
Okay, so these are policies that we have been told by Mr. Wood of the California Special Districts Association, their chief financial officer, and a person we have a contract with currently that we are required for in order us to pass an audit. Otherwise, we will get audit exceptions. These are the 7 he identified that were necessary. These have been reviewed by both our attorney and Mr. Allen. So with that, yeah, go ahead.
Okay. So on
So-
behalf,
Board questions? Okay. Public comment?
so are we commenting
We
on all
comment-
of them or just the first
No,
one?
just policy 3.
Well, that's why I wanted to say
I'm
that
sorry.
first.
I'm sorry. I interrupted you. My
We
apologies.
got it? Okay, let's go.
Titled Internal Controls, Policy 3. So for the public, I sent an email to the board about this. I actually forwarded it to some other people too. The title, Internal Controls, is misleading. The proposed policy is only concerned with financial matters and that should be made clear if it's going to proceed beyond a first reading, which I think this is a first reading and there should not be a vote on it at this point. If it does go forward, this policy needs serious amendment. Parts of the document appear to be pulled from elsewhere. Witness the line 1A, which references a finance department. MCHCD does not have a finance department, so I think this was just pulled off somebody else's boilerplate, as probably CSDA, I guess, is what we're hearing. Too much of this policy is written in that same haphazard manner without consideration to reality and/or situations applicable to MCHCD. As written, this item does not meet the standards of an acceptable first read. It should be pulled from the agenda, either abandoned or drastically restructured before being presented as a first read. For example, line 1H, if rewritten to say, the Board of Directors shall be responsible for authorizing all expenses and encumbrances on the district treasury, the concept would be acceptable. However, that concept is innate to any government board and already covered by this board's bylaws. In other words, rewriting policy that already exists is a waste of time and energy. As written, granting complete and utter authority to the chair, whether it's this chair or a future chair, is not acceptable in a democratic process. Line 1I approaches the same sort of granting dictatorial power to a chair. Neither this chair nor future chairs of the board should possess this much financial control. Current practices, resolutions, and bylaws already cover this subject matter. Line 1E is another example of this doubling down on practice that is already covered. I question the judgment of the individual or individuals who thought this so-called policy was worthy of putting in public, let alone meriting serious consideration.
Thank you.
Okay, thank you for your comments. Mr. Ramos?
I hate doing this to you guys, but I just got to ask a question. Rick Woods recommended this. He also recommended the change of banks.
Mm-hmm.
Have you had a second opinion on these policies are actually valid and needed?
As I said, we have had them reviewed by the attorney and Mr. Allen.
Okay, thank you.
Okay. Okay,
And
no
I
public
did-
comment, board discussion?
Okay. I did want to say, and I would certainly go back and look again, because the initial documents that we had were boilerplate language from the Special District Association, which we thought we went through, like there were things that referenced ratepayers, for instance, which we don't have ratepayers, so we took that language out. So there may be things that need to be corrected, although I'm not sure if the example of a finance department, defined department as people being involved in the finances of the district, I'm not sure that that's a critical thing. And we did talk about how we want things to go through the chair. Not that the chair is the ultimate dictator and authority, but that expenditures and encumbrances, before people go encumbering money, at least the chair should know that that's happening and have some authorization. So if it feels that it's repetitive of what we've already discussed and decided, I think that was the intent, was to adopt policies that put all of those conversations in one place, so that every time we go to do something, we don't have to reinvent the wheel, that we're going back to policy that we've adopted for this is how we want it to go.
Are you done?
Yes.
Okay, so at this point, do we have a motion to approve?
No, I
Well-
want to speak to this.
Yeah.
I was surprised at Mr. McDonald's take on this, and I think we have to take into account what he said. We can't gloss over something as profound as his words were. So I don't want to vote for this yet, but I want to ask if, since I noticed that Mr. McDonald was reading from a script which he prepared in advance, which is good, whether I could get a copy of that so I can review this in an appropriate way with the kind of intensity and focus that you ask for.
Mr. Garza, may I respond, please?
I'm
To say that it was emailed.
No, he just asked for permission.
Come on, let's keep the order here. Okay,
I didn't get it.
okay. Director Savage?
I'm sorry, that's my timer.
No. I was only trying to clarify that I think the question was whether or not he could.
Why didn't I get it?
And the answer could be no, but that was just a question.
I'm sorry, I couldn't hear you.
No, that was the question that came
Okay.
from, that was,
Okay, do we have a motion to approve?
can I ask another question before we have a motion?
Certainly, that's what we're doing. here.
Okay. Since there were things that came up, and since Paul said he would like to see more about this particular policy, is there an urgency, Mr. Allen, with this particular internal controls, or could we consider this a first reading to be adopted at the next meeting? Through the chair.
Wayne, did you hear
No.
Secretary Savage's question?
Okay, I don't know what's up with this mic.
Wayne,
I know, I'm sorry, you guys.
she's asking, is there an urgency for this adoption, or can it be tabled to a subsequent
Well,
meeting?
can be considered a first reading to be adopted at the next meeting.
Which
There's no urgency, well, within the next 3 to 6 months, so it's not urgent. It could be tabled.
Can I make a motion to table this?
Okay,
You can.
I will. I did.
okay,
Do you have a second?
and I'll second it.
Okay, the roll call?
Okay, Paul Katza,
Yes.
Susan Savage, yes, Sarah's absent, Paul Garza.
Yes.
Okay, so it is
Okay, can we go on to the
tabled.
next one?
Now, I have a procedural question, the difference between tabling and considering this a first reading to be adopted at a subsequent meeting, because do we have to take it off the table? Or can we just consider it moved to the next meeting for second reading?
You tabled it.
You are right. You consider it just moved to the next meeting. You do not have to take it off the table. It's a motion to postpone that, to table it out. So
Okay.
I think your intent that you're looking for, Secretary Savage, is it can be done through the motion that you just had. You're welcome.
Okay.
Okay, the next policy that the committee looked at was a policy on credit card use. This again was taken from recommended language, was recommended by the Special District Association. Mr. Allen weighed in on it. At this time, the use of credit cards by our board is very, very limited. But we felt that this policy would be helpful to have in place for how we'd like to manage that.
Okay, any questions, Director Katzif?
No.
Okay, comments from the public? Mr. McDonald?
So I emailed a statement about this to the board earlier. I'm using the pcatsf@mcdh.org. So I'll send it to your personal one too, later tonight or tomorrow. Granting a credit card to a temporarily employed subordinate of an independently contracted company is a dangerous precedent for a government body to set. I posed the question to officials serving on other government bodies. The question being, would your government entity give a credit card to an RGS employee? The question was posed to officials who have employed regional government services. The response boiled down to responses like this, quote, no way, and quote, irresponsible. Please pull this item from the agenda. I could go on to say that if it was my business and I hired a temp, especially one who only has 2 more months on their current agreement, I cannot believe that I would think of myself as being responsible to give them a company credit card.
Mr. Maroney.
Thank you. I don't have a personal opinion about this specific item. However, in general, if there's something that's not critical, like a policy like this, usually what I've seen, and to respect the community and the incoming board members, what you would do is first fill the vacancy, you know, out of respect of diversity of opinion and, you know, basically your constituency. If there's an important policy to be passed and you have a vacancy that you know you want to fill, first you want to fill that vacancy. Then you would vote on certain policies. Thank you very much.
Okay. Director Savage?
Can we talk now?
Yes.
Yes, okay. First off, the kinds of expenditures that we were looking at is things that pretty much require a credit card, like paying for the Zoom account. That you have to have a credit card in order to pay for that, and the alternative, rather than have the district responsible for its own Zoom account, we're not like the city of Fort Bragg where we have multiple departments and various people. We have one entity that, other than having board members themselves pay for it and get reimbursed, that it felt like a rational thing to do, to have the one person that we do have who is accountable and responsible to the district to have a credit card for those very limited purposes. Now, it's certainly, I think, up to us to make sure that we do due diligence and make sure that any charges on those credit cards are responsible and authorized by the body and not something that's inappropriate. So I think given our unique situation in that we don't have a staff of multiple people who might otherwise do, and there are expenditures that require a credit card, that made sense.
Yep.
So therefore, our recommendation is to adopt it.
Okay. There are
Mr. Chair, the credit card policy would be the exception to what I said about urgency. It does have a sense of urgency because it's a day-to-day thing that is being used right now, and then it would be my responsibility to review the receipts and make sure they're in good order and they're for business use, so it can be controlled by me, and it does have a sense of urgency. So.
Also point out that Regional Government Services does carry crime insurance, so if there were fraud, we could recover any costs that were inappropriate. So are you moved this?
Yes,
Okay,
on
you
behalf
have a
of the
second?
committee.
I'll second it.
Okay, let's, okay, headed for a vote. Roll call.
Okay, Susan Savage, yes. Sarah Spring absent. Paul Garza,
Yes.
Paul Katza.
Yes.
Okay.
Okay. Okay, next policy, number 8, has to do with purchasing and processes and procedures that we should have in place when we're considering purchasing. And I'm not sure that we have anytime soon contemplated purchasing vehicles. However, that provision was included in recommended language, so we left it in there because who knows? If we're doing mobile healthcare in the future, that might come in handy, so.
Well, we also purchase ambulances, don't we? Anyway, yeah. Okay, any questions, Director Katzif?
No.
Okay, let's go to public comment. Seeing none,
I'll make a motion that we pass policy number 8, titled Purchasing.
Okay, I'll second.
okay, roll call?
Okay, Paul Garza.
Yes.
Paul Katzif.
Yes.
Susan Savage, yes. Sarah Spring, absent. Approved. Is this the final one, I think?
Yes,
Am I
it
right?
is.
There's
Okay.
9, yeah, and 10.
Okay, I'm on number 9. No, there's 10.
Number 9.
Number 9 is accounts receivable. But I believe this is the one that we don't anticipate that we have a lot. Am I right, Mr. Allen, that we're not anticipating that we have large or any sums of money that are owed to us other than anything that would be transferred from Adventist Health? Is that correct?
Yes.
Okay. But in the possibility that there might be things in future, this outlines how accounts receivable would be dealt with. So I move adoption of policy number 9 on behalf of the policy ad hoc.
A second?
I'll second the motion.
Okay, well, roll call?
Okay,
Did we get public comment on this one?
Okay, public comment. Go ahead.
Thank you. I would note that this policy number 9, which I don't have a problem with, but it states, it has the wording that there's a monthly review by the CFO, Chief Financial Officer. Whereas the credit card policy, I'm not seeing that in writing, where I've heard it verbally, but I don't see it in writing. That's part of my objection. If it had that wording, I don't think I would have stepped up here.
Okay, well, I think that's actually a very good suggestion that we could amend next month to add that. Okay, I have no problem with that at all. I like 2 eyes on every thing.
Chair, if I could correct, it is item D in the credit card policy.
Oh, it is in credit
Yeah,
card
it's
policy.
there.
Well, let's move on. We'll take a look at that.
okay, so we do have a motion on accounts receivable?
Yes, move in second.
Okay. Okay, Paul Katzif?
Yes.
Susan Savage, yes. Sarah Spring, absent. Paul Garza?
Yes.
And we're approved. And then I think this one is the last one.
Yeah, code of ethics.
Yes. Which is a little more extensive. Again, I think, if I'm not mistaken, that this is not only, we had looked like months and months and months ago, comparing what the county, the city, various places have, because we're required to have a code of ethics included, and that this pretty much straightforward from the Special District Association language that has to do with how we conduct ourselves. So on behalf of the committee, I would move adoption of this code of ethics.
Public comment. Okay.
Just want to point out.
I'm sorry, I couldn't raise my hand fast enough. Put me in when you can.
Okay, we'll recognize you in one moment, please. I've already recognized Mr. McDonald.
I apologize.
Thank you. Just want to point out that credit card policy number 4D does not say the CFO. Again, it's back to the chair thing, which I object to. I have no problem with the chief financial officer being that person. I don't like the chair or designee.
Well, if I designate the CFO anyway. Okay. Ms. Stockel. You have the floor.
I'm sorry, I only interjected because I thought nobody was going to comment and you were going to close the comments. So I was a little bit slow there.
Okay.
I love the code of ethics. It rings my bells, and I think you heard that, when I was speaking earlier about my own integrity. So that's great. I see these financial policies, these credit card policies, they're all spot on. I think you're missing a very important policy, and that's to avoid, that's social media, how it's used, and especially to avoid social hacking, which would compromise the district, and especially when it comes to these hackers now, Russia, which is Russia and a lot of Eastern European countries, but they're not the only ones, who trick people into giving away information so they can hack in and then hold accounts in hostage for money. And I mean, if you want to see your money all fly out the window, that can happen overnight. By basically holding everybody's information hostage. It's a big thing. It happens a lot. Maybe we're too small to be noticed, and we're maybe, hoping to fly under the radar. But I think it's really important to lay out to everybody how social hacking works and what to be on the lookout for. And maybe even an educational seminar to protect the district from this kind of thing. And I'd be more than happy to help either in a role as a board member, or if I don't get voted, then in another role. It's near and dear to my heart, and I'd be more than happy to help in any role in which I can. So I would love to see that as another policy. Thank you.
Thank you for your offer of help. Director Savage.
No, I was just going to clarify, because I wrote down social media policy, but then you also mentioned training, which could be part of what is either suggested or required in a social media policy. So that definitely could be something that the committee takes up as well.
Okay, thank you. It's a good suggestion.
Thank you.
Any more public comment?
And I just want to say that we're not too small to be noticed. My company was noticed, and we were held hostage by the Russians for $500,000. Fortunately, they missed one security wormhole that they didn't find, and the FBI told us, and we got our information, and the FBI told us to tell the Russians to go to hell. But not before, and insurance doesn't cover, if you give them the money, your insurance company will pay you back, but you have to give the money first. So, and then you have to use the right kind of lawyers, you have to contact the Federal Bureau of Investigation, there's a whole industry behind solving the problem of hacking and ransomware. So it is really important that not just us, but that the hospital, with all those records, be secure. And it has to be our policy that, we have a security expert right in the room here, right over there. Am I speaking truth?
You are.
Yeah. So.
Okay. Okay,
Call for the question.
Okay, any more public comment? Seeing none, okay, do you have a motion to approve?
I'm sorry, who's the security expert?
Please, we can talk about that later, please, let's move on.
Okay.
Okay, I had already moved it.
Okay, so, Director Katz?
I'll second it.
Okay. And call for the question, yes?
Question.
Okay, Paul Katza.
Yes.
Susan Savage, yes. Sarah Spring, absent. Paul Garza.
Yes. Okay.
Approved.
Now we have
That's it.
let me check my agenda and make sure I'm in the right place, but I believe we're for board comments.
Yeah, I just wanted to say how important it is to get our next director approved. Had I voted no on these last four policies, they could not have been passed. because it would have been
agreed.
a minority passing them, and that's not.
Right.
So to have just one person absent really compromises our ability to function. And so it's more important to have somebody that we don't all necessarily agree on as the perfect candidate, like you, like all of us were perfect candidates, right? It's more important to have somebody than to, good is, let's go for good, not perfect.
Okay. Okay, good advice. Director Savage?
No,
Okay, then I entertain a motion to adjourn.
I'll move we adjourn.
I'll second that motion.
Okay.
I'm doing a lot of seconding.
All in favor?
I gotta pick up my daughter.
We're calling roll
Oh,
call.
I'm sorry. What am I
Yes,
doing? I'm back to
yes.
my old nonprofit days. Sorry.
Okay, Susan, yes. Sarah, absent. Paul Garza.
Yes.
Paul Katzis.
Yes.
We are adjourned.